Right. I see Dr. Betty Everett is here. So I've done my little housekeeping announcements, Betty. So if you want to just say anything else, and I'll turn it over to you and then to Tisha Dean for the panel.
Good morning. I'm happy to be here. I really enjoyed yesterday's presentations and I really look forward to today's. I just wanted to actually comment. I want to ask you to come back and make the announcement about the ARPA CEs.
Okay. Okay. I think I know what you're talking about. So so we everybody knows in order for us to do these CEs in an APA approved way, we have to every 5 years or so submit information to renew our application, then we get approved to continue to do this. So folks, I know folks have done that in the past who are on, so you know what that process is like. So we recently got approved to continue to provide APA approved CEs. But the big news is we got the home study approved. We've been trying to do that for years. Yes, Lisa, I see your face. Yes. So just so you all know what the home study is it allows us to expand what we're doing with our CEs, right? Yes, big deal, Tisha. Yes, big deal. So what that means we're able to do is we're able to expand beyond these kind of live presentations, right? So we can do pre-recorded. It just gives us flexibility with the type of CEs that we can offer. So we just got approved for that. That took some effort. Yes, Jan, some hard work, some hours with Betty and Eric DeRay, others contributed to that. So please keep an eye out for that, right? So we might send out emails. We're going to access people where we can do some pre-recordings and we can just think creatively about how we're going to do it and allow you all to really be able to receive CEs in a more convenient way. Like you can do it at your own pace, at your own convenience. And then as a side note, that's a way that we can bring in some revenue as well to just keep ARPA sustained financially. So very excited about that. Yes, very.
Yes. Kudos.
It was indeed some hard work. Anyway, that's about my news for today. I'll turn it over to Tisha.
Good morning, everyone. I'm going to be selfish and ask if anyone feels comfortable to turn on your camera just because I want to look at everybody. I know, Judd, you're in the light, so you don't have to if you don't want to. It's Jan. Hi. So my favorite thing about the ARPA Fall Conference has always been seeing all my ARPA friends. And so I've really missed the last couple of years not being together. It's Patty. Hey, Patty. And Gary and Pat. Good morning. So, and Sally, hello. And Amy C, good morning.
You sound like Romper Room.
Romper Room? I don't know what that is.
Old.
I know what Romper Room is.
Thank you.
The children's show.
Yeah.
That's a different generational reference.
Yes. So for all of you who remember me dragging my little baby into ARPA meetings, she is now 13 and we are looking at high school next year. So we can all have a collective old feeling together, okay? So I just wanted to say hello, and I wanted that to be part of today is for us to be able to kind of get together and have some time to take care of ourselves and to enjoy our time together. So today we were talking about wanting to do some ethics hours and training as part of our conference, and I really wanted to delve into this topic. So thinking about self-care and self-nurturing and how that is a piece of our ethical obligations and ethical work as psychologists and in the mental health profession. And so I wanted to also bring one of my really good colleagues and friends that I met a while ago while I was a graduate student, Dr. Bridgman, to come and speak with us, and then brought in Dr. McNair to talk with us about some initiatives that ARPA is wanting to do to help kind of facilitate and help us in this process. So my hope for today, I hope that everyone can enjoy the talk, that we can relax and be, and have some fun, and really kind of support one another. One of my favorite things about being involved in ARPA is the support that we get, and so I hope that we can get some of that today. I'm going to share my screen. We hope you guys see that.
Mhm.
So I've already introduced our panel, or what we're going to talk about today. So I was just going to give you a little bit of background on me. Most of you people know me, but for those of you who don't, and maybe you might learn something if you have known me for a little while. So right now I'm working at UAMS as an associate professor and as the director of behavioral health integration for the integrated medicine service line. So I'm really interested in and passionate about integrating behavioral health care into primary care and kind of changing that culture. And part of that has to do with having a culture of taking care of ourselves as professionals, and the medical field taking care of themselves in such a way that they can provide good support for patients. As most of you know, I've done all my training here in Arkansas. So the University of Arkansas, Fayetteville. I did my internship here at UAMS. And I did my postdoc at the VA in North Little Rock. And so I'm pretty grounded in this community and have had the amazing, fortunate career of being trained by many, many people who are here today. And I really feel very fortunate for that. I also have spent time working at the Little Rock Community Mental Health Center. And in that work, really have learned and got a lot of, I got an education on the importance of taking care of yourself whenever you're working with people who have significant psychosocial difficulties, and kind of like what we had talked about yesterday, if you were there at the talk yesterday. And as part of what brought us to this moment is that when I was a grad student, I worked as the liaison to the APA graduate student liaison to the advisory committee on colleague assistance. And that's where I met our panelist, one of our panelists today, Dr. Diane Bridgman, who was, I believe, the president of that committee at the time. And that during my help and work with that committee, I really learned about the importance of providing support to psychologists and mental health professionals, and also the challenges that we face, and the importance of keeping that conversation going. And so that background is probably one of the biggest things that led to this panel today. Also, I'm a student of meditation and yoga, so I'm a certified yoga instructor only for my own health and benefit. I don't enjoy teaching yoga. It's hard work, but it is. I really have enjoyed being a student of yoga. And as most of you guys know, I'm a mom. I have a teenager, so that means I have to do lots of self-care to keep her alive. And then I love the outdoors. I'm an ARPA enthusiast. I have served as the president, past president, all that, as treasurer, and as the government relations committee chair. I am also a Razorback fan, for better or worse, and also consider myself an amateur lobbyist and advocate. So I share all that just to kind of demonstrate, that we all have so many different facets to our lives, and that's a big piece of taking care of ourselves, is recognizing all those pieces. I'm going to introduce Dr. Bridgman. I'll let her build on this, but just, and this is her bio, so you guys can take a look at that. But Dr. Bridgman is an expert in the field of kind of self-care, wellness, resilience. She's worked in disaster mental health. She, as I said, was president of the Colleague Assistance Committee for APA. And she has done many talks and thought really hard and long about these topics. And so I'm incredibly excited to have her share some of her thoughts on this. And she's also got some really great resources that can help us to kind of delve deeper into this for ourselves. And then we've got Dr. McNair, who has been a longtime member and very active in the Arkansas Psychological Association and throughout our profession in Arkansas. And she is thinking about and spearheading some ideas for how we at ARPA can support one another and can kind of build a community that will kind of build on the things that we've talked about today. So our objectives for today is to describe and discuss how wellness and self-nurturing are connected to the ethical practice of psychology. Oh, okay. Be able to describe some unique barriers that exist for us in engaging in wellness and self-nurturing activities, and kind of look at ourselves and describe and be able to think about some personal ways we can overcome those barriers, and then to be able to kind of identify some specific self-nurturing activities that we can build on. So I'm hoping, for me personally, selfishly, that I can do some of these things too, and that we can all think together about and come away with some real practical things that we can do to take care of ourselves and each other. So I really like this kind of conceptual idea that comes from an article through this is through the Mayo Clinic. And it's talking about physician distress. And we are medical professionals, doctors within the medical field. And I think that this really kind of, to me, summarizes some of the things. And I love how it's kind of moving towards something I think is much more sustainable and helpful. So they talk about how we started out in the kind of the era of distress, which was where helping professionals are kind of like deity, right? They are all knowing, they're perfect, they can work forever, they don't need to take care of themselves, they can work alone, and they are high performers, right? And that is kind of the expectation of helping professions, that they're just, their ability to do everything. And I know I can see that, and we can see that in training for medical professionals, and in training for in our profession. You're expected to really do well all the time. And then they talk about well-being 1.0, which is kind of like where we have been in recent years. Which is, you've still kind of got these hero-like qualities, but we recognize that wellness is important. We should have work-life balance and build resilience. But that work-life balance and wellness is kind of another task on top of all of these great things that you do. And that's something that I hope that we can try to move away from and talk about today. And then there's kind of well-being 2.0, which is what the field is trying to move into, which is recognizing that helping professionals are humans, just like everyone else, that we're vulnerable, that we grow and change as we develop throughout our profession. That we integrate our work and lives, not that there's this balance, like you work and then you leave, and then that they're all intertwined. and creating and fostering self-compassion. So having lower expectations and being okay with those, building community and having meaning and purpose in work and life. That's kind of the way that the field is moving. And I think that that's really a positive thing. And we'll talk more about that today. Just to kind of, another thing that I hope that we can talk about is the fact that burnout is a reversible thing, that it's a problem and it's a problem that has solutions, but it's not just you have to do things differently. It's not a burden on ourselves personally. So thinking about it from organizational change, personal change, and patient change. So the people that we work with, the expectations that we have for them and they have for themselves, that those are all pieces of things that we can manipulate and change, and not just putting all the burden on that middle piece, right? Just your person. You've got to change yourself and then everything will be okay. Because I think that just adds stress. The only thing about this slide, it's very busy, but that I think is important to think about it as a framework and to recognize, again, there's these individual factors, but there's also work unit factors, organizational factors, and the entire kind of like national culture and culture of medicine factors. And that's kind of where my advocacy brain comes in to say, it's not just things that I can do personally, but what can we do as a profession? What can we do as a psychological association? What can we do in our organizations that can help create changes that will build a better self-nurturing environment? All right, so that's all I have for this morning, just to kind of build the conversation. And then what we're going to do is Dr. Bridgman is going to talk with us about her kind of thoughts on these topics. And then at Kyla, whenever you feel like we need a break, let us know. And then Dr. McNair will speak. And then we will have a thoughtful discussion. And I hope that we can all be participants. And I think Dr. Bridgman will talk about that.
That's excellent, Dr. Dean. This is just Dr. Holmes for a sec. Dr. Bridgman, would it be okay if we kind of prepare for a break around maybe 10:15 or so? That'd be okay. Okay, you're on mute just for right now there. Okay, you're on mute, Dr. Bridgman. I'm not able to hear you. Yeah, still can't. Let me do this. Okay.
Okay. We're okay? Yeah.
Yes, I can hear you now.
Great. Good. Thank you.
Okay.
So, hello, everyone, and it's really wonderful to be here. I want to thank Dr. Dean for inviting me and to be able to meet you and work with you. And I'm hopeful, so much of this is information I know you know, but maybe with all of us coming together and looking at some of these concepts and talking about it, we can even find better ways to support ourselves and each other, because I think it's really important that we do. Let me tell you just in the very beginning, if you have any questions or comments, absolutely don't hesitate. Put your hand up and we'll call on you and you can share your thoughts and your point of view. I think you all probably have so many rich experiences that you can work from, and we can learn from each other as we move along. I just want to start by talking a little bit about the concept of self-care. I've used it for years and continue to. However, I find it, maybe because it's been used so much, it seems to represent a more simplistic kind of sense of, well, just take care of yourself, which is pretty obvious, of course. But I think there's so much more to it. And I think there's more depth and more importance. And so we might want to search around about whether it matters what terms we use. Some of the alternative terms that I use are listed there. And I particularly like the coherence building part of it, but that's maybe for some doesn't feel like it quite gets to where they want to go. But let's look together again throughout this and see if we can find a good way we can help us move forward. Eric, if maybe we could slow down the slides and I'll say when to move them on, that'd be great. You're fine now. We can go on to the next slide now. Thanks so much. Appreciate it. So this is an early study I did with an APA researcher, Dan Gelper, and we looked at 700 national psychologists from APA, and they replied on the survey. I just want to point out we had pages and pages of interesting results, but just these few couple results now. That 64% said they sought therapy if something was going on in their lives. And we really applauded that. And we thought that was really important. But they added the statement later, it was only if it was a very serious issue. Many of them felt it had to be that to prompt them. And we are trying to encourage, you don't have to have a serious issue to go talk to someone, whether it's a therapist you've seen before, or even just checking in with a colleague. Let's be on top of things before they get more serious. Another result we found is most people weren't practicing much self-care, even though we were really trying to begin to really emphasize that. And so that was concerning. And 72% said it was the number one challenge was a need for a better work-life balance, which we're going to hear that phrase over and over again. And yet it is rather key, but we could get beyond it. But first, we really have to make sure we're grappling with it and addressing it. And 96% did say yes. When I apply a work-life balance, I feel better and it's effective, but yet most people weren't really applying it to themselves. So why are we still having these challenges talking about promoting wellness? And I think it is because we never take it quite seriously enough. And now maybe has some little piece of this very horrendous thing called the pandemic helped us to find the real importance of self-nurturing. And maybe that's going to help us move forward in a better way from this point on. Let's hope so. Next slide, please, Eric. Thank you. And Ken Pope, who you're going to hear me refer to a couple of times, a psychologist, who I like his quote. It's not simply that we thrive, that we survive, but we thrive. And that's, I think, we have to work for beyond even just kind of wellness. It's really thriving and feeling like we really can be in touch with what's important to us, whether it's what's important regarding our joyfulness or our work related, but allowing that feeling of joy and creativity coming to the fore. And we need to ask ourselves what keeps getting in the way, and how to see helping ourselves as not one more thing to put in the schedule, but something we look forward to, an opportunity, not a threat. We know we respond better when we see things as opportunities and not you have to do this. And we know that being empathic, which most of us are fairly empathic people, that takes us into the field of psychology and why we're doing what we're doing and why you're all probably very good at it. But that self-nurturing, that interest in helping others and being empathic is so central to what we do that we have to nurture ourselves to allow that to continue, because it can deplete us. And so how to work on ways of really supporting our ability so we can work at the level we want to. And lastly, I'll say over and over, please look at a lot of what we're talking about with some grace and kindness to yourself. It's not going to help you work towards wellness and thriving if you really are too demanding about your self-care. That will defeat the whole purpose. So give yourself some moments of grace and time for inspiration. Okay, the next slide, please, Eric. Thank you. This is a general study that APA does every year, Wellness in America. And this year, the recent one, 2021, as we might expect, the levels are really quite up quite a bit from last year and the year before. 59% negative work experience causing stress, 67%, of course, of frontline workers. Oh, excuse me. If we can go back to the next one, Eric. There we go. Thank you. No, let's see. Yep, that's it. Thank you. And 74% felt uncompensated, causing them stress. And then a similar results from the 2021 Gallup poll. The mental health needs, if it can really hold on to this and grasp this concept, worse than in the last 12 decades. And so that's really telling us that these these stresses we're experiencing now are some that we've never to the level we've ever seen before. So causing us even more to have to take in the importance of looking at what's going on and how do we deal with it in a way that we can still feel like we're working at the level we want to. Hayden talked about, again, this is all recent work, that her caseloads are greater than she's ever had them be in 20 years. And Huminski was saying that she used to get maybe 1 or 2 referrals a month. Now she gets 3 per week. And that it's hard to turn away people. I think we've probably, everyone on this phone who's doing clinical work on this Zooming can relate to the fact of getting a call from someone who's very stressed out and really wants to be seen, and you just can't fit in one more person. And the stress that causes us to have to say, you know, I'm so sorry, I wish I could take you on, I really don't have the room. You could try some of these colleagues and I'll give you their names and numbers. And of course, knowing that most of them are pretty full as well. The stress of having to do that is outrageous and unfortunate, and affects us and affects who we treat and work with. We, as a result of being so busy, we don't take as many breaks as we should. Eric, maybe if you could let the slide stay on the slide I'm talking on until I ask to change it, that might be great. That would be helpful. So if we can go back once again.
My apologies.
That's okay, no problem. No problem at all. Thank you very much. Just that, let's see. Okay, and talking about more frequent sessions, our usual clients, and this is where I thought really complicates things, already needs to be seeing more than they usually have been seeing, because they're experiencing not only the pandemic, but the economic stresses and the racial stresses and all the political upheaval we've all been through. All of that's been working at presenting some collective traumatization that we ourselves as therapists are experiencing and our clients are experiencing. So we have to take that much more time to see them. So it makes it very difficult. I just wanted to see a show of hands. Maybe if you could just put up your hand, how many people can relate to having this extreme need in their practice to be have people be seen? Are we? Yeah. Okay. Okay. Good. Thank you. Just wanted to get a sense of that. Thank you, Eric. On to the next slide. Thanks. And just as some ways that our psychological associations could be of some help. When I was talking with the head of APA's ACCA committee, the committee I chaired for a couple of years, the current committee chair, she and I have been emailing, talking about various things. And I looked for the recent map that they show of how many states have psychological associations programs that where you can go and talk to someone as part of a colleague assistance program. And now we find that 16 states no longer even have this, what we call colleague assistance program, we refer to as CAP. 6 states have limited CAP services, and 2 states have the formal full CAP program. So there may be a state psychological association, but they don't have that program we used to really support and encourage. We'd have meetings, we'd bring all the people who are doing CAP-like work together in Washington and talk about what's working, what's not working, how do we support each other. But many of them don't. And the reason why they don't, unfortunately, is the ugly head of the legal system. I mean, I have 2 daughters who are international human rights attorneys, so nothing against attorneys, but because of liability concerns, they cut away that part of the state psychological association programs where you could have a colleague assistance program and go in and talk to someone and give you the support you need. So it's really terrible. It had to be for that reason. But a couple of the issues we used to see just a little ways back, the 2 primary ones, there were many others, was substance abuse and boundaries with clients. That would be offenses that therapists might be exposed to, experiencing. Right after that, they did a lot more trainings on boundaries with your clients. And we found that, in fact, they were much less prevalent as a result. And that's a success of sorts, that people really responded, heard that, or removed themselves from the field if that was something they couldn't work with. So we work very hard through ACCA and through our state associations to really help people go and talk to someone, and hopefully maybe a colleague. And we tried to say it wasn't a sign of weakness. We were trying to do away with that whole old concept, but a sign of wisdom instead of weakness and wisdom, and to not feel ashamed. And I think that's what's happened in the past with maybe for a lot of different reasons. People felt that I'm supposed to have it all together. Here I am helping other people. I've gone through my programs. I've gone through my own therapy. I should be okay, which of course we know isn't the case. We experience what everyone experiences, and we need to work through some issues as well. So we really wanted to find a place, a sweet spot between maybe we don't have that organized CAP program many of us used to have. So I came up with a concept called colleague to colleague that I implement on our local level. I have our local psychological association, and then I'm with our California Psychological Association, and we call it the CARE Committee. And so what I developed was just called colleague to colleague, an informal process where you could call me and want someone else on my committee just to talk. It was not therapy. It was confidential. And we made sure we were saying we weren't dealing with really serious issues. If there's an issue around suicidology, we had on our website lists of self-care links to go to, and the number for the National Hotline for Suicide Prevention, and our state association's ethics chair. So we had resources for those kinds of issues. But we were saying, look, if you just are having a difficult day, or it's been hard lately, or because of the pandemic, or because of some issues you're having, call us and we'll just hold it and hear it and listen. And that's been a helpful way to get from at least not having the colleague assistance program, but not having nothing, a way to show support, to say we care about you, we're there for you. So that's been a helpful program, and our state association is thinking of adapting something similar to it. Okay, we can go on to the next slide, Eric. Thank you. So we hear a lot about burnout. I'm going to talk about this a little bit and differentiate that term that's been around for years and years. But we know that prior to the pandemic, us as clinical psychologists and other psychologists weren't doing self-nurturing as much as they knew they should. And then with the increased demand, we found that made it even more problematic, and more that we might be really affecting our imperative need to follow taking care of ourselves at our ethical demands that we do. And what we're also finding due to the pandemic, I see a lot of physicians and nurses and other therapists in my practice, and I was hearing the term over and over again of moral injury or soul injury, feeling really this deep, deep sadness and troubled feeling about what was going on with their practice, with their patients. Just having to see someone you couldn't do much more for, having to see someone who shouldn't be in the throes of dying who were. It really struck people and continues to strike people at their core, as we can, I'm sure, all imagine. And how to really say it's no one's fault, but how do we really give attention to these people who've been wounded in that way, and to look at these experiences of our collective economic climate changing, political issues. How do we acknowledge those and address those? And how do we talk about it? And just for a minute, I want to say some of the issues, they're saying, well, maybe you shouldn't be talking about this in your psychology meetings, or with your state association or your local association. So I developed a separate group, whether it would work for any of you, I don't know. And I call it Concerned Psychologist. That's okay, we can just stay there for a minute. So informally, outside of my local psychological association and my state, it's a separate one. And I called it Concerned Psychologist. And we once or twice a month get together and talk about all issues, whether it's political ones that we think might not be quite as appropriate, but we really need to express ourselves, or talk about clients who are presenting with some of these issues. How do we address issues of color, issues of race, issues of people who have no money to see a therapist, but desperately need to see therapists? So we could problem solve and we could support each other. And that worked out really well. I think we should be able to integrate even more of that within the psychological associations as well. But I know there are some constraints. So we purposely set this up very separately, and that's working out well. A very current study by Ferencz shows that on a 10-point scale, 5.9, almost 6, they said that they felt levels of stress. Again, 41% reporting burnout, 30% said they're unable to meet their client demands. But one encouraging finding that Ferencz found was that 66% did employ some level of self-care. That's an improvement over recent years, and that's very good. It should be higher, but it's better than it's been. 55% found the benefits of, again, of that old Trojan horse, the positive work-life balance. It really does work. We really need to get it in place, but you have to fashion one that works for you, not what a cookbook tells you or somebody else tells you, but finding out what's a good work-life balance for you. And one issue I'll be coming back to over and over again, I feel very strongly about it, is how do we both serve our clients with diverse backgrounds and people of color, and how do we bring in more psychologists? Many of us have been talking about this for years. Bring in psychologists of color and psychologists from various cultural backgrounds into the field of psychology. It's been a desperate need. And I must say, as much as I've been an APA member and serving on committees for years, they've done a really poor job of it until recently, and only because of a lot of pressure. So we're having to make up for that. And it's been really, I think, even just tragic we haven't done more with it. So I'll come back to that issue throughout the talk here. The next slide, please, Eric. Thank you. So I know we all know this. We know it's our moral and ethical prerogative and imperative to take care of ourselves. When we take care of ourselves, our clients do better and our profession does better. We're respected because people have good results, because people feel they've been really helped. So it's really this link. It's intrinsic and it's really very obvious, but we need to make sure we really see the full linkage of that. From taking care of ourselves, we can better serve our clients. We are more helpful in the community, and our profession takes that on as they can feel very good about what we present and what we offer. So everybody benefits. And we know as a result of work-life balance that people find that the research supports it very highly. When we have more optimism, we have fewer errors in our work, there's less illness, and overall there's a sense of well-being and enjoyment from our work. Okay, the next slide, please. So this is a refrain we've heard over and over again if you've ever taken a flight, the airline oxygen mask analogy, but it really does kind of fit here. So if we're taking care of ourselves, I mean, we're going to be able to be there for others, whether it's our family, our community, our religious group, or our clients. And so they thrive when we thrive. And that's just the idea of bringing that all together. Thanks. Eric, the next slide, please. So this self-nurturing. Now, I was just wondering if any of you could share one or two that really seem to work for you, or one that you've tried. Oh, I'm sorry, I have some hands here too. So before I ask you about that question, let me say, Camera Mays, do you want to share your thought? You have a question there, your hand's up. Maybe if you're muted, you might want to unmute.
I think she may have
I raised my hand earlier.
That's fine.
I'm
Yeah.
sorry, please go ahead. Please go ahead.
Oh, my hand was raised earlier when you had asked the question and you said, could you raise your hand? It was actually about 20 minutes or 15 minutes ago.
Okay,
Sorry.
great, thank you. And Patricia, you have your hand up. Was the same reason, or did you want to say something now?
Sorry, same reason.
Great, that's okay, no apologies, absolutely, you're right. Anyone want to share one or two particular nurturing, wellness, thriving strategy that works well for them that they've tried, or one you've tried and it hasn't worked, and there's some interesting cautionary tale there you want to share with us? Anybody want to share anything in particular that they found that was helpful? Patricia?
I'll share.
Please, yes.
Well, so in January, I started Orange Theory Fitness. I actually sometimes see patients for Doctors on Demand, which got very overwhelming because I had a contract with Walmart. And so everybody that was going through something started seeing me. What started as a part-time something turned into almost another job. So I needed to do something. And some of my clients kept mentioning this Orange Theory Fitness idea. And I don't know if you know what it is, but nevertheless, I started in January, and it's been probably my best release that I have from the other stuff I do. And so I make it a priority to do almost every day if I can, but any day that I'm available, I try to get a class in, and you're only competing against yourself. And so I do that on a regular now. I think it was pretty awesome. I encourage others to do so.
Now, I've heard of it, but I don't really know anything about it. Do you want to very quickly just tell us what that means or what it is, what it
Well,
involves?
Orange Theory Fitness is based on this idea, of course, about the high intensity interval training types of that you need a lot of something and then get your heart rate down to a certain level. But orange is the color that they often ask you to try to be in. That's the level that you'll have more benefits once you stop working out. Your body is still actually moving, or the metabolism is still worked up. And so they have different classes that
Right.
are always something different. So no class has ever been the same. And I did my 100th class in August. So I'm still doing it, trying to get to my 200th class. So, but it's based on some scientific exercise physiology stuff that says this is what you need just to be having good cardiovascular numbers. Just keep moving. That's the bottom line.
Excellent. Thank you very much. And thank you for both sharing it and for what you're accomplishing. That's wonderful. Let me just talk about a few things. We've got some that are more serious and some less serious here about suggestions. And you really have to develop ones that work for you and find out what fits. We know that an occupational hazard is isolation, especially if we're doing clinical psychology. We're in a room with our client and we don't have ways of really connecting with others. And so that has become an occupational hazard and can lead to being very stressed or isolated or feeling very alone. So some ways to combat that stress is joining your psychological association, whether you have a local one, a state one, whatever level. Consider joining them, consider chairing a committee or being on the board or helping in some way. It can make you feel vital to know you're part of your own profession and help people there that you can talk to and connect with. The other one, the phrase we always tell people is consider meeting with colleagues or at even one colleague, whether it's once a week or once a month, and just a little check-in, maybe going for a walk, you build in nature and fresh air and talking to someone. So taking a cup of tea, going for a walk, and join a consulting group. That's the other that really can help people who get to know you. And in fact, when we're talking about ethical lapses, which can happen more when we're not taking care of ourselves, when you're with a consulting group that knows you and you've joined them, they may hear you describe something later, a couple months down the road, for example, and say, wait a minute, you just talked about that particular incident with that client. You might want to be careful there about boundaries. I'm not sure. They know you, they respect you. You can hear it and not feel judged and say, oh my goodness, I didn't see it that way. That's something for me to think about. So having a group that knows you and can help you, then that can keep you from lapsing into possibly really having an ethical issue. So it's very important. Consider a consulting group, start it up yourself, join one. Even if you meet once a month or whenever it works, it can provide that support, the comfort, the connection, and can help ethically. And I just mentioned here, Waldinger, I want to mention his study. He carried out the longest developmental study in psychology ever to be carried out when he was at Harvard in 1938, and he interviewed young boys from Boston. He interviewed them every 3 years until in their 60s, and he found these fascinating results. He found that out of all of them, the ones that did the best psychologically and physiologically were those who felt socially connected. He said it wasn't based on their income, their educational background, or their genetics. It was that those who did the best psychologically and physiologically in terms of their heart rate and diabetes and less depression were those who had social. If we can stay on that slide for just a minute past that, Eric. So they felt, so he's recommending that staying well connected helps us physiologically and psychologically, and finding that social connection that works for you. We're not saying too, as a result of his study, that they were the same people they were connected with throughout all those years, or many people. It can be 2 or 3, it can be different ones throughout the years, but just that we have that bonding, that connection, that support. Okay, and then the other things, we tell our clients all the time to use a lot of these strategies, but do we apply them to ourselves? Can we parcel out the ones that might really work for us? We might share with them something that they do and they like, but we don't feel like we can do it ourselves. That's fine. Out of all the many ones of guided imagery, relaxation, a gratitude journal, how to feel grounded ourselves. find, we're the masters of that, but yet often we don't apply it to ourselves. Find what works for you, and they can help you then better identify some of your triggers so you can catch things earlier on, and they can lessen the impact of what's going on by catching them before they go into something more that gets worsened over time. And then the very basics, the three things we all know that we hear from our family doctor, that we read in our journals, is the whole idea of getting healthy amounts of sleep, a healthy diet, and good exercise. We know it helps with keeping our blood pressure down, it helps with our cholesterol, helps keep our weight in balance, lightens our mood, so helps us physiologically and psychologically. Those three basics, how to remind ourselves of these kinds of very simplistic, I know you know this stuff, but it's important that we remind ourselves. Thank you, Eric. The next slide, please.
Diane,
Yes.
this is Tisha. I think Patty had her hand raised. She was going to share.
Oh, thank
with
you.
her.
Thank you, Tisha. I see that now. Yes, thanks for pointing out. Patricia, do you want to share some things?
Oh, yeah, just a few things. I try to exercise regularly. I do yoga, walk,
Great.
ride my bike. And then the main thing I'm doing at work, when I eat lunch, no work. Because
Good.
I was eating lunch and doing reports, and now I'm like, no, just eat lunch, watch something on YouTube or whatever, relax.
Yep.
That's made a big difference.
Excellent. Really good point. We may think we're taking a break and then fill the break with getting more work done, right? You're absolutely right, Patricia. Thank you. That's really helpful. Thank you.
Diane,
Yes.
everyone, I put a link to the Harvard study with a TED Talk in there.
thanks.
It's really, really good. I've listened to the TED Talk. It's great. And just kind of bringing out some of that stuff that they found from that study. It's a really neat study.
Great. Thank you, Tisha, for that. Yes, he's done some excellent work. And just some more ways that we take care of ourselves. Again, we share these tips with our clients, but are we reflecting on them themselves to see if they might work for us? So what we do, I really want you to respect the kind of work you do. I'm sorry, if we can go back to that for a moment. Thank you. That it really takes a lot of courage to be in an office with someone and holding some of these very important feelings that they share with us. A lot of courage. We have to take responsibility. I want you to appreciate yourselves, your gifts, your accomplishments, and to really hold that dear, and to know that you want to value that, and you value that by taking care of yourself. And this is a very minor tip. We find that if you have challenging clients, maybe it's someone with borderline personality, maybe it's someone who's really having a manic episode, try not to schedule. This is very simplistic. You all know this, but just to remind yourself, try not to, if you can possibly arrange it that way, to not have really challenging clients one after another. Spread them out in your schedule if you have the advantage to do that. It helps you catch your breath, helps you be there more for the next person because you are remembering to do that. And then just that we're holding these difficult feelings. And sometimes our clients are talking about really deep feelings, really serious feelings, really down feelings, whether it's depression, anxiety, a panic attack, bereavement, whatever it is they're coping with. That's heavy, that's hard. We are holding it. We are trying to, sorry, if we can go back to that for just a minute. So if we can remember that we need an antidote to the negativity and seriousness, and that might be finding lots of different ways of getting an antidote to that. But one I mentioned is just the use of humor out of the office place. Sometimes even in the office place, it's fine. But out of it, can you find people who are lighthearted? And we know that emotions can be contagious. So if we're around people who are upbeat, we might feel more upbeat. So if you can, find ways to be around people who are in good moods a lot of the time, have a sunny disposition, maybe exploring a humorous movie that you want to watch, a podcast that's particularly uplifting, if that's possible, hopefully somewhere out there. But put that into your repertoire so that it's not all the seriousness and all the heaviness, so we can go back and hold the seriousness and be more effective with that. Thank you, Eric. The next slide. For some reason that spacing is different than it used to be, but that's okay. Just some of the areas. Early, before the pandemic was just really starting in China, Britain came out with some information about psychology and information from Oxford, and they were talking about how we have to prepare. There's probably, predictably, going to be mental health epidemic of sorts, and they were absolutely right, and I really could understand that. And what we found is at least 3 areas that I call a mental health trifecta that were going to be exacerbated because of the pandemic. And sure enough, the 3 areas, there are many others as well, but these are the 3 main ones we found, is an over-reliance on substance abuse, higher domestic violence, and suicidology. And unfortunately, more recently, we've added to it child abuse. All of those factors and levels have gone way up, unfortunately, due to the stress everyone's experiencing. And so we need to be prepared to deal with that, how that feels to us, or our own level that's been exacerbated by it. And do we have the training to help people cope with those extreme levels? And I call it, how do we consider this cascading collective traumatization? And can we help it through a collective coherence building? Those are the dynamics I try to use. And if we don't have the training, we need to get the training. And that's where our psych associations can offer specific workshops, classes, and training on these various areas on self-care, but also on traumatic trauma and collective traumatization. And so how do we ask for those trainings? How do we make sure we get them? And how do we make sure that they should be giving you CEs for it as well as encouragement? So just to know that it's unique, some of the experiences we're facing, or the level or impact of it is unique. Okay, the next slide, please. Thank you. And here's some ways, again, that the psych associations can help us. They can do things like, for those of you who take insurance, how to streamline the paperwork. We have lobbyists and we have people who work with those groups, how to help them say, this is one way you can help us, is make that paperwork less odious and more straightforward. How to maybe increase the reimbursement rate. And I want to talk about reimbursement rates for just a minute. Many people, especially in areas where maybe there's a higher income level, don't take insurance at all anymore because they want people to pay out of pocket. They say the insurance doesn't pay them enough. And so if someone doesn't have insurance or has insurance, but there's no one to see because they don't take their insurance, they're left high and dry without anyone that they can see. So we need people who can take a sliding scale. I have a certain proportion of my clients are either pro bono or sliding scale fee. And then I take just one insurance, used to take several. And so we have a spectrum. So everyone in the community is served. And that could be people without any insurance. That could be people on welfare. All people need to be seen in mental health. Just 1 minute, if you can go back, I want to see if there's any other point there that I want to share. And that make sure we have the training to help those people. Let's see where, yeah, here. So this is ways that the, back again, I'm sorry, to another slide, I think it was back. Yeah, before that one too, yeah. Let's see. Yeah, back one more slide, I think we'll do it. Yeah, let me tell you when to move from one to another if I could, that would help a lot. Okay, so.
I'm
so
sorry,
that-
it has a mind of its own today.
I know, I'm sorry, thank you. So I was talking about what the psychological associations can do. They can take on some of this and help us cut through some of the red tape, help be our voice, be our lobbyist, our representative, to get the trainings, to make sure the reimbursement rates are correct, to help with people who have very limited means. We shouldn't have to fight the battles, although I'm very big on political advocacy and I've done some work in that area. And I think we all need to do some work in that area, but that our psych associations has the power of its volume to bring to bear on those associations. There may have been something in between, but Rooney from Missouri, who did a very recent study, found that 1 in 3 mental health workers do report burnout. And I want to talk for a minute about some of the differentiation with burnout, the way it was first. If we could just stay on the slide until I say, could you please move on? That'd be great, Eric, so that we can have some continuity of thoughts here. With burnout, I want to differentiate. When this came out in 1978 by Freudenberger, who would coin the term burnout. And then after that, the major amount of the work was done by Professor Christina Maslach at UC Berkeley, who is still lecturing about her work in burnout, and she developed the Maslach burnout inventory. There is a difference between burnout and maybe we might call, again, compassion fatigue. And it's usually the workplace is not providing the support we need. We get maybe stressed by it, but it's important to differentiate. The difference is the workplace is maybe expecting too much of us, putting pressure, telling us how many people we have to see, especially if you work at a clinic or an agency or a hospital. And so we need to, Erica, if we could just hold it on one slide for a while, that would be helpful until I move on to the next one. If we can go back again.
Eric, do you think that maybe there's a timer on the
Yeah.
slides that they're progressing?
Yeah, it sounds like it's
Timer.
self-timed. Yeah, if you can change it so you're in control of it, that'd be wonderful. Thanks. So anyway, the point is burnout, the way Freudenberg first described it, and for sure Christina Maslach's primary work in it, she's even stressing today and reminding people, it's the workplace is organized in a way that people don't feel regarded. They don't feel like they're being heard. That's a big difference I really want to emphasize. When we're in private practice, like many of us are in independent practice, we can kind of make our own hours, and still we might feel impacted by too many clients, but at least we're arranging how we see those clients. But if you're working with an agency, a clinic, or a corporation, even a nonprofit sometimes, you may not feel like they're hearing you, they're disregarding you, you don't feel appreciated, even more than salary. Salary is important, of course, but even more, the scales and the studies show it's feeling respected. Years ago, I was looking at some work on that, and the Japanese were doing quality circles where they had top management employees at all levels and maintenance workers come together to talk about what do we do to make our workplace feel appropriate. And I talked to people in Germany about that and here about that, never got very far in the United States, as you can imagine, but that's what we need is respect. So if we can ask the psych associations to help us renew that feeling of being heard and respected, we don't mind working really hard, but it's hard to work hard and not have that. And again, and I think that's part of the moral injury as well. He's recommending that some of this vicarious traumatization should be helped in various ways. He lists some ways. I have ways that I list, but he lists self-nurturing isn't self-serving, by the way. And that's what we often hear people say, oh, I don't have time for myself. Yeah, so if we can stay on a slide, that would be really helpful. So we can go back again. Okay. So not to see it as self-nurturing, that self-nurturing isn't self-serving or self-indulging, or I should know better. I should have my act together. I've been in therapy. I'm a therapist. I don't need it. If we can all get beyond that, or maybe thinking like, I don't want to look at self-care and because then that's an issue I don't want to have to look at right now and shine a light on it. Or maybe I feel the stigma or shame with that. Or maybe our perfectionism, and some of us had to be somewhat perfectionistic to get where we are, gets in the way. We all have issues. Even some old issues might come back given all the stress we're experiencing. Whether you see a therapist you've seen before, or you see a new person, or you just talk with a colleague, get the support. You deserve it. And I talk about the benefits of wellness. It's both preventive and it prevents us from having problems. It's protective. And it's something that's proactive. So if we can try to remember that, it'll take us in some healthier directions. And again, we know when we're achieving some wellness, it gives us more levels of tolerance and flexibility. And I thought in one interesting finding in a study, it promotes less need for recognition. If you feel good about yourself, you don't have to hear as much of that. I think that's a lovely byproduct, and it can strengthen our goals. And a book everyone should read, and hopefully in grad school, is Norcross and Vanderbilt's book on self-care. He's a leading expert. He and I have done some work together, but his work is really important, Norcross. And the book came out in 2018, and I think it should be in all grad school programs. And it just reminds us to develop our own unique self-care model, and to be aware of that. Can I ask for a minute, how many people had a self-care course or lecture? It should be more than a lecture, or lecture in grad school. Just raise your hand for a minute. I want to see how widespread it's been over the years, or back when you were in grad school. Did you have a class or a talk about self-care? Could you raise your hand for a moment? Most people did not. Is that correct? Yeah, I'm getting a sense most people didn't. And if they did, it's probably very recent grads. And that's really important, that it's in grad school, it's modeled, and you get credit for it. If you have to take extra workshops, you get your CEs, but that we model that ourselves to our families, to our kids, our young kids, our teenagers desperately need to know about wellness and thriving, and in college. And I think all the way through the lifespan, I say is let's find the lifespan approach. It will change as you're aging. It should be for seasoned psychologists. It should be for retired psychologists, this whole wellness spectrum. So
Diane?
yes.
Hey, this is Tisha again. Do you think it would be prudent to take a break right now?
Absolutely, we can do
Okay.
that.
And
Absolutely.
maybe during that time, we can figure out what's going on with your slides.
I
'Cause
appreciate
I know
that.
that's stressful.
I know, well, that Eric and I worked it out yesterday or Wednesday night, but I think it might have reverted back in some way. So I'm sorry. My apologies to everyone for that
Oh.
piece.
It's no
Yeah.
problem at all. So why don't, Kyla, do you have any announcements before we take a break?
Yes, yes. If I could do that, that would be great. And what I do, I might just go ahead and share my screen real quick here, if you don't mind there, Eric. I think I can do this on my end. Okay. All right. Thank you. Thank you all so much. Thank you, Dr. Bridgman. It's been some great information so far, and we look forward to the rest of the panel.
Thank
So
you.
just for this break, maybe we could take about a 5 to 7 minute break. But as we're doing that, I would like to, if possible, I want to kind of share my screen. I tried to do this yesterday to share this save the date, and I am going to do it today. It
Good
will
for
work
you.
today. So let me see if that worked. Can you all see it now? I think yesterday was a white screen. All right, good, good, good. So I did
Oh,
announce
good.
yesterday, but I wanted you all just to kind of see that so you could see the name of what's to come. You can save the date in your calendars. So as I mentioned yesterday, as the Professional Development Committee, we're going to try to every year offer some type of CE around ethics, right? Because this is important when we renew our license. So, and it's just important for us to kind of think about, of course, as practicing professionals. So on April 22nd, we have already confirmed this with the trust. And so we're going to have Dr. Bryant to come out again. If you all remember, she presented for us last year. Excellent presenter. She did a great job. So we asked to have her back. So she is going to present about risk management and vulnerabilities, yours, mine, and ours. So please look out for more information about that. That's going to be 6 CEs, and that's going to be April 22nd, 2022. Tentatively, we're thinking about if we could do it in person, that would be awesome, but we are also prepared to just do it virtually again. So we'll keep you all posted about that. All right. Okay, and another thing that I want to announce, again, we know that we have had sponsors. We're going to continue to try to do that. I know Dr. Everett and I believe Christy, right? She's on, hopefully she's on today, but they have worked hard along with Eric and others to make sure that we have sponsors for our events. And I think that that's just so awesome. So I mentioned yesterday that Arkansas Families First has been a sponsor, a gold sponsor, and then also Chelsea Wakefield. So she took her time out to, since she wasn't able to join us today, she's prepared like a video. So I want to just play this video during this time while we're on the break. Let's see if this can work. 1 second, you all. I hope it can. All right there. And then if the people that I see, maybe Betty, if you don't mind, when this starts to play, if you can give me like a thumbs up that that you could hear when I get to it. Okay, hopefully you all can see it, and then you could tell me if you could hear it. Okay. 1 second.
That's a negative, Kyla.
Okay, yeah, if I could tell, let me see. All right, we're gonna try that one more time here.
Hi, everybody. I hope you're enjoying the conference. For those of you who don't know me, my name is Dr. Chelsea Wakefield, and I'm the director of the Couples Center at UAMS, where I do couples work, train clinicians, and offer workshops in the community, hopefully in person soon. And I wanted to tell you about a couple of offerings that I have coming up soon in terms of training. Some of you have trained with me before, and some of you might be interested in this upcoming offering. It's something people have been asking me about for the past year. I'm going to do a 6-week class on the essentials of sex therapy. And as it turns out, I am the only AASECT certified sex therapist in Arkansas. And I'm currently doing a lot of supervision to try to train other people to work in this important area of the human experience. I think that as I talk with most clinicians, we get very little training in human sexuality in graduate school. And so many therapists are not comfortable in opening up the topic, even with couples. And I can't tell you how many couples have come to work with me that have said to me, our last couples therapist never asked us about our sex life, and we haven't had sex for 5 years, or we were constantly in conflict about sex. So this is a very, very important topic that a lot of people don't have a lot of training in. And so I'm going to offer a class, The Essentials of Sex Therapy. It begins on November 12th, and you can find out more about it and register for it by going on the UAMS Couples Center site and looking under upcoming workshops. So I'll tell you a little bit of the topics that we're going to be covering in this workshop. And the first has to do with the necessary personal work that each of us needs to do to be comfortable in talking about sexuality with clients, looking at our own formation, our own history and upbringing, our beliefs, our assumptions, things of that sort. So we'll be talking about that. And then we're going to talk about how to open a conversation with your clients and with your couples in a way that makes it safe for them to begin to explore and talk about intimate concerns. We'll also be talking about assessment. What do you ask? What are you listening for? And how do you formulate a treatment plan that actually addresses the right level of where people are having difficulty? And there are different levels that people have difficulty with sex. Some of it has to do with general discomfort and anxiety and having permission to be a sexual being or sexual in the way that they actually are templated or want to be different. Some of it has to do with basic sex education. I am continually amazed at how few people actually know how bodies work. And so I do a lot of basic sex education. And so assessing where people are in how much they know, in their general development, in their own definition of who they are. And then sometimes people need more intensive therapy. And certainly couples have a lot of difficulty talking about sex. So we'll be talking about ways of helping couples enter that conversation in the initiator inquirer exercise. That'll be part of what we'll be looking at. And then some helpful interventions for very specific sexual dysfunctions. So I encourage you to check that out, find out more about it. If you have any questions, please feel free to email the Couples Center at uams.edu. And then in January, we're going to be doing a program based on my book that is finally out, The Labyrinth of Love. And you can check that out on Amazon. It has a lot of helpful information for therapists. And also I've heard from the couples that have read it that it's a really readable book. So they can grasp some of the essential concepts about, number one, the developmental passages of relationships, and also the 6 love capacities, which I emphasize a lot when I'm working with couples. I'm a very capacity-based couples therapist, and I really believe that people develop these 6 love capacities, that some of the problems that they're struggling with will, rather than being solved, they will be transcended. Relationship is a path of growth, and when people begin to look at it as such, it changes everything. So that program will be offered in January, and please check that out. There's more information on the website. Maybe order the book in advance and then bring your questions and your cases, and we'll have 15 minutes each of the 8-week session to talk about your cases and answer your questions. So I hope you'll come and join me. This is an important area of mental health work, working with couples. It helps not only the couples, but the families and the children and the entire communities. So I hope to see you soon. Thanks a lot. Bye-bye.
All Okay, I'm glad that that worked and glad you all were able to see it. Please check her out. Like she, you know, that she's been here. People who have come to our CEs, you've heard from Dr. Wakefield, people at UAMS, I know are probably familiar with her couples centers. She has some great information and great content that'll just be beautiful for us to continue to support and learn about. So Eric, it seems like we're maybe ready. I think that was probably a good solid, maybe 7 or 8 minute break. Are we ready with the slides, Eric? Was that
Yes, I believe so.
resolved?
Yes,
All right, excellent. Okay, I'm just gonna turn it back over to Dr. Bridgman. Thank you.
thank you, Keila. It was great information. Sounds like a great group class she's offering. I think we can go to the next slide, Eric, and let's see if we can reclaim where we were. If we can move on to the next, thank you. Okay, I think we were here too, so we can go on to the next one. Okay, and we've talked a lot about boundaries, just a little bit again about this classic topic. How we're really, we share our information with so many people, and we're very giving and very compassionate, and that's why many of us are in the field of psychology, and in particular clinical psychology or practicing as psychologists. And how to really remember that because we're giving so much all the time, this becomes what's known as one more of our occupational hazards. And we need to be careful how we're setting our boundaries and how we relate to people. How many of you, I'm sure, can be someplace and someone asks you about a problem they're having and they want some help from you. And as much as we so want to help them and we know what we could say, we try to refrain from that, and knowing we have to honor those boundaries. Many people put a lot of pressure on us and corner us without even meaning to, without even realizing what that's like for us. And so how do we make sure we honor those boundaries and do it with confidence and know how important that is? Okay, next slide, please. Thank you. And this is one area I've done some research on and really talked a lot about is resilience. And it's one more term that I think has become a bandwagon term that really doesn't show the depth of it. There's complexity and depth here, at least from my perspective. There was work done years ago in Africa about how some young kids in a village were handling so many difficult situations, the lack of food, lack of care, lack of time to be with a person. That work led to looking at how does one become more resilient. And we know, of course, as people have traumatic experiences, they need to work on using some of that to help them become more resilient. I have a model that I call trusted reciprocity. And what that means is if you can find one other person in your life that you can talk with about some of the important issues to you, that could be, again, your therapist, your partner, a religious leader, a community leader, anyone you respect, who you know is not there to judge you or make you feel shame or embarrass you, but will listen to what you feel you want to look at, where you made some errors perhaps, or some judgment lapses, and you want to learn from it so you can move forward. That security and safety of feeling trust can help you really move forward. And I think it's really important we all look at being able to allow that for ourselves, in addition to providing some of that for our clients, finding someone you can be with that in that way, who's not there to judge you, embarrass you, make you feel bad, but you can be vulnerable, at your most vulnerable, and therefore look at things you've done and help yourself see where I could do it differently. I think it's really important. And again, as I say, it's so much more than pulling oneself up from one's bootstraps, but let's keep that in mind for ourselves. Okay, next slide, please. Thank you. I'm talking just for a little bit about something we all know. We've heard a lot about having Zoom fatigue, and some research has been done about it. It's been exacerbated by the pandemic. Absolutely. I mean, there's some real benefits of social media and virtual learning. We don't have to commute. We're not polluting the environment. We can bring in people from all different distances. There's flexibility, some wonderful assets to doing things virtually. And we also know that social media can be very helpful and connect people from really isolated areas. It can be a real benefit, but we also know there's some downfalls, and we also know that it was purposely and intentionally set up to addict people. I live right next to Silicon Valley and have people from Apple and Facebook in my practice, and it's been acknowledged and openly documented and movies on how it was set up so that when you get, so endorphins are given off and that triggers a dopamine and we get that bit of reward that we want to hear the next email result. We want to hear the shout out in the chat box. We want to see who's responded to our email. We get that and it's very exciting and it gives us that dopamine rush, but it's also that we become dependent on that. We can become addictive to that and we have to look for the next one and the next one. And it causes enormous anxiety. A year before, just before the pandemic, we had a major conference we have every year in my city that I'm on the advisory committee. We had 400 people attending one on social media. And it was very clear how addictive it was, especially for young people, especially young females. Now it's coming out even more in the news, but we've known it for a long time, but for adults as well. So how to be aware, it's got wonderful attributes, but some really steps we have to be very cautious about. And we'll talk more about the study. The next slide, please, Eric. Thank you. Okay, so Fallville from Sweden and Nickerson from Stanford did some research and they put together what's called the Zoom fatigue scale. Just came out in March of 2021. And they were looking at nonverbal cues, how people are only seeing the shoulders and the head visible. And here we are, of course, Zooming right now. So I'm talking about how this is somewhat problematic and yet we're using the very medium right now. But as I said, there are many benefits, but there's some problems. Interesting from their findings, subjects felt trapped in one spot with a constant real life reflection, causing them to feel this anxiety, which they labeled mirror anxiety. It's anxiety for some who brought about a real self-consciousness. They could also be distracted by it, and the links caused anxiety and depression. Next slide, please. So going on, they also identified a term they call hypergaze that can elicit this really intense feeling of being stared at. And again, I know we're replicating some of the very things they're talking about, but at least we're talking about it. And this is a very interesting finding, that faces appear so large that our brain and our cognitive system saw that as this dichotomy, an invitation to either, get this, mate or be in conflict. And that caused enormous intensity of feelings. So it's really important to know what we're doing when we use some of these technological ways of communicating with each other. They report that women felt that Zooming, spent more time Zooming with shorter breaks, and men felt greater mirror anxiety, and people of color reported higher Zoom fatigue. Next slide, please. Thank you. And they recommended a few things, as use of an orange filter that they thought could reduce eye strain. They also designate maybe one should plan a day a week to be Zoom free and require a 10-minute buffer between calls. I think we should have more than one day a week Zoom free if we can, maybe several days, and do take those breaks. Even if you just step outside, if you're at home in your backyard, being in nature, stretch a little bit, have a cup of tea, that's going to help you when you come back, whether it's a workshop or a meeting or with a client. You're more able to concentrate and be there for them because you've taken a moment for yourself. So building in those times and buffers between your calls, your clients, your work is really important. And that's why some therapists are finding telehealth with phone calls in many areas even better than Zooming with our client. And I don't know what the state laws are in Arizona. Many states are still allowing people to have either the virtual or the phone calls for sessions. Please do check with your board and your professional society what's recommended. But especially if you've seen a client before in the past when you saw them in person, and then seeing them via a phone call can work really well, and clients feel comfortable with that. But do check on what feels right for you and your client. Okay, next slide, please. Now, talking about how even further, I think we've been trying to say, as we do better, our clients do better, and our profession does better. So the link is clearly there, but just recalling some of these ethical principles of psychology, where it says psychologists should respect the right to dignity, privacy, confidentiality of those they work with professionally, and also strive to minimize our own biases. This is really important here, as I've underlined it. Be aware of issues related to diversity and concerns of particular populations. Now, I personally, who have been working on these political issues for years and years in social justice, think it's really shameful that it wasn't until March of 2020 that APA added this last line: be aware of issues related to diversity and concerns of particular populations. They added that same similar line to one more of the principles we'll talk about, but we have not pushed on APA hard enough to embrace fairness and equity. And it's long overdue, and there's been a lot of pain and people who haven't been served because of it. I feel just very strongly about it. But to think that that was just added in March of 2020 says it all, unfortunately. So we have a lot to do to compensate for our profession's lapses. And we all need to do our part. Don't leave it just to the heads of your organizations. We all need to do our parts, whether it's in voting and whether it's advocating. We need to be there. Next slide, please, Eric. Here are the principles you know so well. And we're supposed to promote the well-being of our clients. We're supposed to do no harm, of course. I know you know all these. We're bound by duty and loyalty. We don't attempt to deceive or misrepresent. Principle D, justice, be fair and impartial. And principle E, here again is where they added this one line afterwards about equity. But principle E is the one: respect for people's rights and dignity. And then the last part in 2020 was added, that people's rights and dignity for equity reasons. Again, showing you how far behind the curve we have been as an association. Next slide, please. Thank you. Fred Hunter, who's from the California Psych Association, one of my colleagues, recommended various ways to look at an ethical dilemma. He identifies it as a risk management concern. If you have one, it could be in one of several areas: clinical issue, legal, or ethical. And it could be a combination of some of those. If legal, consider your practice consultation from your professional association's director of professional affairs, or if needed, seek a mental health attorney. And in the next slide. Rosenberg and Sheets said it's always helpful to check with a trusted colleague if they have appropriate training and experience. And that's important to find out, whether it's an issue for you where you're wondering about ethical issues, or a colleague comes to you. Make sure you go to or take them to someone who has the training and experience to really advise you well. And consult with your psychological association's ethics committee, your state review board, check on APA ethics standards. Maybe your insurance, if you're malpractice insurance, mine particularly is with the trust, whichever insurance you have, they have built in people to help talk you through a lot of it. So just remember, we're going to try to do things in advance to prevent us slipping down into some ethical lapse. But if you do, there's help for you. Don't just panic, but get the support and help you deserve. And Pope, once again, Ken Pope, warns that neglecting self-care, this is a link right here, can lead to an empty professional life that brings less enjoyment, excitement, fulfillment, and then we might even lose interest in our profession. I might add to that, though. A while back, I reviewed a study that looked at, would you choose to be a psychologist again if you had a choice? And it was something like the high, 92% felt, yes, I would choose to be a psychologist again. And I get a great deal from it, even though there's some problems with it, with the field. I very much feel it's an important part of my life. So unlike the whole burnout thing too, to remember, most of us like what we do and we like doing what we do, and that's why we're doing it. But it doesn't mean it can't be very hard for us still. So how to get back that opportunity to value what you do and why you went into it to begin with. And I think that's what all of this is about. Next slide, please. We're almost at the end here. That therapeutic alliance we all talk about, it's the centerpiece of our therapy and our work with our clients. So it's important we do a periodic assessment of your own compatibility with each client. You may feel like all of a sudden someone's presenting with some issues that you're really not sure if you have a reference point and the knowledge and training to help them. Maybe you can get the training and still work with them. Maybe you should refer them. But that's important that we look at that therapeutic alliance that helps clients really move forward. And it can also prevent ethical lapses and working towards this wellness and thriving we've been talking about. A couple of things, I think we missed a couple of slides. We'll stay here for just a minute. Other ways that I think our associations, our psych associations, whether it's state or local, NAPA, where they can help us. And this is very minor in its detail, but I think it can have big ramifications. And I was talking with the head APA person who has a chair committee that I had for ACA, and our state association person as well, that we have small little ways to show all psychologists they're being appreciated. So again, this is so simplistic, but if we could send either in the mail or via email a little note letting them know, when you thrive, we all thrive. We appreciate you. Thank you for what you do. Very simple. And maybe we could list on it 3 or 4 key self-care strategies or links, and maybe a picture of some flowers or nature or something to lighten it up. But just a way to say, you've been holding a lot. You've been there through so much with climate change, with the economics, with the ethical issues, with the pandemic. We hear you. We know you're holding a lot. We appreciate you've been part of the fabric of our country as we try to take care of this collective traumatization that we've all been through. I think that would go a long way. It's simple. It doesn't cost much money. It's using wisdom. And I think we all should get that out to each other. And that's where the psych associations can. And the ACA current chair was really supportive of the idea too, as well as our state care committee person. And I'm going to make sure we do it locally. So just thinking about how you can say to each other, great job you're doing, or hanging in there, or what can I do to give you some support, can go a long way. So I think it's really important to know there's a lot we can do. Next slide. And Hess from our California Psych Association had a good quote here. She says, stealth ethical dilemmas can develop gradually. Often they move step by step beyond what was once a firm professional boundary. That's again, the idea, you're probably trying to do everything right, and you probably are, but it's so easy to just slide a little bit into something that maybe isn't quite what we should be doing. And so if you take care of yourself, you're more alert to that. You can pick that up, or you're more open to it. Or if you're with a consultation group, which right here is one more reason, they can see that. And your consultation person can say, boy, I've never heard you mention that before. You might want to look at that. I mentioned that a little bit earlier. They're there to support you and help you. And you can hear it from them because they're not being negative to you. They're being helpful to you. And I have one handout that has some different links to ethics and that you can look at as well. Okay, next slide. My last one. This book, I can't recommend it highly enough. Please all try to read it if you can. It's The Ethics in Psychotherapy and Counseling, a Practical Guide by, again, Ken Pope, the one you've heard me talk about. And Vasquez, who was president of APA a while back. She's a wonderful person too, but Ken Pope has done some tremendous work. And again, as you notice, this just came out July 2021. And notice it's the 6th edition. I think that tells you a lot. He's been putting this book out there for years, and it's got everything in it you need to know. If you read this book, or you can maybe get it from the library, and I even suggest, because it could be expensive, the psych associations, our state level, could buy some copies and maybe share them or give them to people, or especially to students, or especially low-income people. Get the book out. I think there might be an e-version of the book, I'm not sure, or maybe an e-reader kind of thing. See if your library has it, or leave copies in a room that psychologists visit that they can share the book, put on the bookshelf. Also, I must add that Ken Pope has an extensive website. I've gone to it many times. I've emailed with him about some issues. He's got everything there that you'd ever want to think about, even how to take care of pets and how to help yourself and help others. Every issue, he's got it on his website. So plan to visit Ken Pope's website and take in what he has to say. Next slide, which should be blank, I think. I just want to say that I really think it's important that you're all coming to hear something that you know so much about, and know that we can continue to build on what we know and make it even more vibrant and more relevant. I just want to say thank you to Dr. Dean, and end with this quote from Kierkegaard, who says, from 1834, philosopher, a fulfilling life calls for playful enjoyment, ethical engagement, a leap to something that can fuse together the fragments of our existence. And you all know William James, and his brother was a novelist and a philosopher. And he said 3 things to remember in life to have a good life and a fulfilling life. And they are be kind. And the second one is be kind and wait for it. The third one is be kind. And I think be kind to ourselves and be kind to others and go with grace. And so I hope that's of some help, and I look forward to the panel of discussion. Thank you so much for being an attentive and great audience. I really appreciate being with you. Thank you.
Yay. Thank you so much, Diane.
Of course.
I was so excited whenever you were able to come and talk with us, and I was happy that I could share you with my friends. So I'm excited. Just so that you guys know, I put a link to the APA, the ethics handout that Diane had in the chat. I also put a link to Ken Pope's website, and it's a really extensive website with lots of really cool stuff in there. So all right, so the next panelist who will be sharing with us is Dr. Lisa McNair. Lisa, do you have slides?
I do not have slides.
Okay.
I was thinking this would be, in fact, for those who know me well, and forgive me, technology's never been just not my forte, but I would like this to be somewhat interactive. I'm going to talk about a context of, there'll be some overlap with Dr. Bridgman, but mainly I'm going to be talking systemically about support systems and shifts that we need to make that you alluded to in your introduction, and that I want to elaborate on. But I'm not sure exactly if I would like the participants to be able to ask questions at different points. And I'm not sure I can see the hand raised and everything in the corner picture, but my response, so I just click on participants to be able to, or just the chat, go to the chat to hear questions. Not sure. I'm not seeing people raise hands. When Dr. Bridgman was speaking, I didn't see any of that. So
You put it in gallery mode, then can you see yourself, or can you see all of
I
it?
can only see myself. So gallery mode, let me
So in
see.
view up in the corner, if you put gallery instead of speaker.
I'm not seeing any of that. Let's see. Let's go to more. No, let's see.
Lisa, if you tap the right-hand corner, even if you don't see anything right now, the view might come up.
Right.
Up in
After,
the corner.
yeah, that's right. There's three different statements. It says speaker, gallery, and full screen, and you might want to check. No, none of that. Top right.
None of that.
Top right under view. Top right.
I have full screen here. Exit full screen. Okay.
It
So
may,
go full screen.
It may not show anything until you tap.
Right. That's right.
Okay, I tapped on full screen. Full screen. Let's see.
Well, go up to gallery.
Okay. I'm not seeing gallery.
Did you tap on view first?
Yes.
And then it brings does it bring up 3 different indications? No. Speaker, gallery, and full screen? No.
Mm-mm.
Oh dear.
I know. Let's see. And I have a new computer too, so this is just making it even.
Yeah.
Lisa, can you tap on chat and see the chat?
Yeah, I have seen people pull up. I've seen comments in chat.
So there's a couple.
I was just hoping I could respond.
Yeah, and Lisa, I can watch and let you know if someone has their hand raised.
Okay.
And also, we can just allow people to also unmute and interrupt if that's something that you don't mind.
Okay. No, I don't. If you just want to, now I'm losing mine. Okay. Let's see. So, I did exit full screen. Ooh, now I've got the text for the chat, which is very helpful. I think it'll be helpful. We'll see. All right. So, So what I'm just going to do is just sort of talk about, is everything set here? And I'm hoping that this chat with the text here is going to be particularly helpful. There. So you ready for me to begin?
Yes.
Hello? Oh, okay. Okay, so some of the things that we've talked about is just the issue of personal self-care and what's been done to help psychologists and support them, and what are some of the limitations around that. So what I wanted to do is sort of set up a context for kind of what we do, which I know you're aware of, but just a reminder a bit about what our training allows us to do. And so all the areas where we venture into practice, which just creates greater complexity in terms of challenges of what we're going to be asked to do, and what we're going to need to be mindful of in terms of providing ethical and competent services, not just to clients either. And it's easier to focus on our clinical work because this shows up so often there, but teaching and research and even consultation, which more and more psychologists are moving into, is they're going to each carry different kinds of expectations and responsibilities, and to be able to switch gears when necessary, even though there is quite a bit of overlap, that each one has its particular responsibilities to both the individuals that we're working with, but also to programs that we're working with, institutions we're working for, and communities, always our communities that we're trying to provide services to. So while we're guided by a code of ethics that attempts very thoroughly to provide us a roadmap of how to do no harm, how to take care of clients, welfare, protection of others, individuals, groups, how we educate our membership, our responsibilities to the public. We're charged to take those ethical codes and considerations to respond to everything we're doing in a way that reflects those fundamental values of being a psychologist. And things are changing, and things are changing rapidly. So I think we find ourselves just in this position now where it's like, okay, now how does confidentiality work when I'm doing telehealth? How does what are boundaries in relationships with patients that I'm seeing, or people that I'm working with if we're texting or emailing? Should I be mindful about that? I mean, what's my responsibility if I'm staying connected to people in ways that maybe weren't even possible when some of us began our practices? So I think all of that is we adapt and we try, but we're often just kind of flying by the seat of our pants with not a lot of guidance, or we're creating the guidance as we go. So there's also a little said in our code about how do you care for yourselves in all of this? How do you protect yourself as a professional and an individual? Treat ourselves with dignity and respect, treat our colleagues with dignity and respect, and not just feel like it's all up to us to figure it out, because that's what we do. Our main goal is to be available to everybody else. Focus usually in codes of ethics, but also in licensure interventions, have often been on the missteps, large or small, that rather than prevent or reduce diminished, I'm going to refer to this as diminished competency, because no matter how competent you are, competency can rise and fall just given the circumstances of life. There are times when you're under so much distress, or there's environmental, external issues going on, or a variety of issues that I'll elaborate a little bit on, that we're human and they act on us. And it's usually the missteps that get you aware of, that there's been some level of diminished competency. So I'm going to be focusing on the problems in our systems of training and practice that fail, or at least inadequately at times, address the distress that's often generated by just the work that we do and the complex nature of the work that we do. And also I'm going to share some data about practices in coping with these systemic stressors that and offer an alternative model that looks more at collaborative work with all the different systems that intersect in our world. So it's a little bit different than what we've done in the past. But again, both Tisha and Dr. Bridgman were alluding to this and talking about how intuitively we form some of these structures for ourselves. But I'm not sure everyone has the same resources or the same capacity to form the kinds of networks and the kinds of systems and mentorships that they need for themselves at different stages of their professional career. So that's really what I want to be talking about. So briefly, just looking at competence in general. So I like this one definition. I found that it's a multidimensional construct characterized by the attainment, the maintenance, the preservation of crucial knowledge, skills, and attitudes that adequately address the diverse, integrated, and complex nature of the practice of psychology. I think that was Rubens, that article by Rubens. But what we know, why is competency so important? Because it is, it's the foundation of our credibility. The reason people come to us, the reason that we're paid for services, the reason we engage in research and we have guidelines around the ethical process of even examining human behavior and talking about it and researching is because this is what gives us credibility, and being competent and staying connected to what the new expectations are or how we need to adapt and change. So, the majority of the people who practice our profession in any of those domains I listed, they have long careers of competent service. And again, we know that competence is fluid, it's contextual, and it's vulnerable to degradation over time. That circumstances and stress, even for the most accomplished psychologists, are going to affect them, all of us. So none of us are immune to that. And that's what it is to be human, even as a psychologist. So the other issues where we are called, it is usually put on us to monitor and regulate, gauge and assess how we're doing, and diagnose basically, and remediate any concerns about reduction in competency, that, you need to stay on top of that. You need to be aware that's part of what we do in terms of our self-care as well. But ironically, research shows us that we're not very good at that. That when we assess our own competency or what we think our level of skill is, it doesn't really match up all the time with what other people would assess and evaluate us as being in terms of where we are with our practice. So here we are trying to do something that's one of the areas where we're often the least skilled when it comes to our own self-assessment. So we need some help. Some of the other things that can impact competency, mentioned again, is compassion fatigue. We know that that's an issue. Vicarious traumatization. Sense of shame can keep us from really addressing or looking at things that feel uncomfortable to look at about ourselves. We talk about shameful feelings or transference issues with clients, at least I do, around just attraction. And that's been probably more talked about than other issues around shame about the way we feel about our clients, including people you may not like, or people you may have some judgments about, or people you don't really understand their own context and where they're coming from or their history of experiences, and jumping to conclusions. We're all vulnerable to those same human mistakes. And so all of these types of things can just take psychologists to a level of reduced competency without us really being aware of. Again, that those step-by-step eroding of how we want to be, how we want to function, how we see ourselves functioning, and the blind spots we have to the way we actually function in the world. So some of the common signs of diminished competency, which, by the way, again, can be and should be a redeemable status with important intervention and awareness. But so what we usually see is violations of ethics codes. And those are the ones that are really the big wake up call. You know, if there's some gross violation, whether it's sexual misconduct or breaches of confidentiality, you know, those the really big ones, some legal concerns, you know, people who get involved in doing forensic work are often very sensitive to walking that line of, you know, dotting I's and crossing T's, because there is that sensitivity to being watched by an external entity even more closely, and wanting to provide good services for populations that are often very angry and fighting and not functioning at their best as well. But other things that are more subtle, like poor record keeping, missed appointments, dual relationships. And let me just make an aside about dual relationships. We've talked about this in other meetings, with professional meetings and amongst ourselves, that dual relationships in a state the size of Arkansas, a city the size of Little Rock, are going to happen. And for those who've worked in integrated care, that's an issue that gets addressed and looked at all the time, because there is going to be an overlap. And what that means is the call for boundaries becomes even, establishing boundaries, talking about being extra clear about boundaries becomes even more important. But when dual relationships begin to spin out, where maybe the relationships that were formerly professional nature have become something more and more important in your life and more involved in your life than really, that it really is not necessary, and maybe violates just the nature of the work that you're doing with other people. We've also got these old challenges, the old standbys that I've sort of referred to, but there's new challenges too. With telehealth and technology, again, we're called on to make some adaptations. You know, telehealth for me happened just all of a sudden with the pandemic. And I think for many others, but some people were already doing that and feeling much more comfortable about it. But for me personally, it was this sense of, wait a minute, they're at home. What room are they in? You know, have we talked about who gets to come in and out of the room where we're talking? You know, some of those things that had not occurred to the patient, and sometimes hadn't occurred to me initially. We might have talked about it a little bit and set it up, but again, just being really mindful about where it's taking place, what we're doing, what to expect, what are the concerns, having that kind of conversation up front when we're just so rapidly shifting over to a whole different mode of communicating. So that's just one example. Electronic record keeping can be very stressful. Some concerns about access to records have raised anxiety for people. Changes in reimbursement are ongoing, good old standby, you know, keeping up with that and understanding how to manage that as well. Concerns over legal issues, new challenges to what we do, how we do it. People can become very legalistic, you know, like maybe I should sue. I'm angry. Maybe I need to go to a board. Maybe I need to sue. So being really mindful about that, because I think 30 years ago that wasn't such an issue as people being very sensitive to legal difficulties. And also, I mentioned the issue of moving more into consultation roles. That's got some special issues along with that too. Sometimes we're not just doing consulting work around just the grounds that we're used to trampling on, you know, I mean, or trampling, there's a slip, but the grounds where we're used to working and interacting with people in healthcare facilities or in clinics, but when we're many people branching out and consulting and acting as coaches for professional groups that are not in our field, and businesses, for instance, knowing what are your responsibilities for working with them? What are your obligations? Are they to the individual that asked you for coaching services, or will it impact their company and other members, board members or investors that they work with? So there's a whole new set of issues to be thought about when people are when we have change in our the way we practice our profession. Okay, so with all that, and this, every time I read these stats, I get a little anxious. So you know, this is not intentional, but important to just remember that in a interview with the head of the trust, which for decades, you know, provided liability insurance. So they've collected data on complaints and what happens when people file complaints or suits against us is that 40%, I was so stunned by this number, 40% of psychologists will get a licensing board complaint. That seems incredibly high to me. Now, most of the time, nothing comes of that, or there might be a reprimand, but most of the time, there's not going to be any substantial difficulties with that. But just having a complaint filed against you and having someone investigate that can be so distressing and emotional, and even maybe impact financially while you're addressing any claims made against you or difficulties that patients, former patients, or people that you've worked with are saying about the level of your work. Now, in terms of malpractice lawsuits, our numbers remain pretty low, but I think around 2%, if that's still accurate. But for a lot of professions, that's still pretty low, and that's just saying filing lawsuits or malpractice claims. But again, even the lowest, the reprimand, can have just serious consequences, and that's not where we want to go. We don't want to end up feeling like our very competency is being questioned, and that is really, really difficult. So just a brief list of ways to avoid. This is the checklist of, again, published, and I think this was a Monitor article in 2016. It's like, understand multiple relationships, set clear guidelines in your relationships, both professionally and with colleagues, but particularly with patients, like informed consent, privacy, etc. Practice self-care, and again, self-care is complicated, and we've just spent some time talking about what does that look like, and how do we get it, and how do we practice that faithfully. Make sure you have insurance coverage. I mean, it wouldn't be the trust talking if they didn't remind, which is important, making sure you have coverage for all the work that you are doing, checking that out and not making assumptions. But staying connected was the area that I thought really fits in with what we want to talk about in terms of systemic difficulties. Staying connected sounds like what we would automatically be doing. That's what we're about. And we don't do a great job about it. We have meetings and we get together professionally, and I think that is really, really important. But it's really not enough. The kind of connection that we're talking about, again, is having a network and having a community that supports you, that you can go to and ask questions and feel vulnerable with, and say, I don't know everything, or I'm concerned about something. But also a more formal network, again, and how we go about forming those, that you've got trusted colleagues and peers, and they can involve other people too. They can even involve family members that know you something about the professional work you do, and also understand that and recognize changes in the level of work that you're doing, but also in the way you're presenting yourself. So this is where I want to focus. As a profession, our work can be isolating, and why is staying connected so important? So I mentioned that research on we're not very good at self-assessment, and that was I think a 2000 study done that showed that psychologists, this is a different one. That was a different study. That was the one by Davis, but this is the one I really like. 2012 study showed that psychologists who belong to state associations were less likely to be disciplined by state boards of psychology. So membership matters. And we know that state boards of psychology, but also professional associations, can be a resource for asking questions about changes in policies, changes in the law, changes in community practice. What are our communal norms? Those are great gathering places for us to connect with people and ask those questions and feel safe, hopefully, as you get to know each other. The research that I was referring to again was the one by there's a couple, Davis and Eva, I think I'm pronouncing that right, on the self-monitoring piece, that staying connected with each other is important because empirically we're just the data doesn't support that we're good at doing this by ourselves. We need feedback from other people who know us. And there's just not a high correlation between self-assessment and external ratings. So why do we have trouble with connecting? And when I say connecting, I mean really connecting and being vulnerable and having these support systems. So part of it, some of the barriers I want to talk about. First is just stigma. And we try to promote reduction. We do a pretty good job to reducing stigma about seeking mental health services. All of us, I mean, most of us at different times have done presentations to different groups outside of our profession about why you need help, there's nothing wrong with that. I know I've done groups. We did a big effort with APA around reaching out for adolescents when the initial mass shootings were starting with Columbine, and there was a big reaction to saying we need to reach out to our community. We need to be doing more community work, because saying it's not dangerous or scary to ask for help, but there still exists some bias in seeking help for professionals, and it. Ben Porath did a study. It's kind of old now, but I think it still holds up. He did a scenario study, a scenario-based research study, and said that he described in the study, professionals and participants in the study were described, they were given an individual who was described as depressed and seeking help. And so they rated that person as more emotionally unstable, less interesting and less competent than the same description of a person who did not seek help. So that's a very, subtle, nuanced shift in what we think. I would not have predicted that outcome. I would have thought we would applaud the person who was wise enough to go and get help. But when it comes to professionals, we still sometimes hold a certain level of, take care of things on your own, that self-sufficiency and getting help is a little scary when our professionals need that very same help. But there's also a phenomenon called self-stigma. Corrigan and Vogel talked about this. And this is the kind of stigma where we judge ourselves. This is not just for psychologists, but certainly we are not immune to that type of stigma as well. So self-stigma was characterized as the idea that when you judge yourself, there's a specific threat to your sense of self, your self-esteem, your self-regard, your confidence. And their belief is that self-stigma can hinder efforts to seek help or ask for feedback about your performance, consult with a colleague, let them know that you're struggling. And I think that can lead to people ignoring problems even when they have some sense that I'm not quite on my game. I'm not functioning where I'm feeling distress, but I can handle this. So that since I can't let anyone know my vulnerability, or they're not going to respect me. I think now I'm going to talk about students a little bit, but I think this goes across from at the student level and training level all the way into our long-held professional practice. And I think the self-stigma still exists. And I first see it in a training process. And for those of you taught, whenever you have to, one of the first things that happens in practicum, and practicums are structured different ways with either audio tapes, so they can have, if you're lucky, you work in a training program that also has, digital tapes of the sessions themselves that are visual. But every year I remember teaching that there was going to be this problem with getting students to bring in tapes. And there's lots of resistance from their clients. But as you know, resistance is one of those strange things that it's kind of gets communicated back and forth between people. And so it was just getting, and I understood it. I mean, having been a graduate student so long ago, I remember being terrified of sitting in a practicum while someone's watching me make a million mistakes and flub something or forget to ask them something and have your peers critique it. That's pretty tough. It does toughen you quite a bit, and it's important to do. But I think that that's that example of self-stigma that we need to get past, that working on judging yourself and expecting yourself to be perfect all the time and right out the gate is just so counter to what we need to be doing to get to where we want to function and need to be functioning. Another barriers, I think, are those is what I would call the old hierarchical or punitive models of intervention that focuses on injury and rehabilitation. So again, you're brought to the board, or you come up with a remediation or a plan for help, of rehabilitation, when injury's already been done, or when someone's gotten concerned and reported you because they see you slipping in the way that you're normally functioning. If it feels punitive, that's the kind of thing that tends to have people hide more, not be forthcoming about their struggles and about, I need some help and I've got a problem here and how do I address it? So it ends up being another barrier. Psychologists are not required to maintain collegial consultation relationships or even assist a suffering psychologist. If we see a breach in our ethics code, we have a duty to talk to the person we're concerned about, and take the subsequent steps. But the piece that's missing is no one says you need to be helping them out. We need to pull together, and I don't mean fix somebody or rescue them from whatever's going on, but to at least talk about it and be upfront about what you're seeing and sharing your concerns. In anonymous surveys, psychologists consistently report their reluctance to confront, and there's that kind of strong word again, confront a colleague. They're worried about negative fallout. They're worried about negative consequences for their colleague, loss of income, harsh responses from regulatory bodies. And I can tell you, and I know boards change over time, they kind of wax and wane, but my guess is that there's more consistency than not. And that is that boards can be scary because they can give and take. Your ability to provide, a professional life for yourself as a psychologist. But in my experience as a board member, it's usually made up of people who have more compassion and want to see our colleagues succeed, held accountable, but succeed. And so if there could be a better feeling about it and more comfort about reaching out to the board when you have a question about something you think you've messed up about, or concerns about what is the policy here and who can I talk to. Sometimes boards can be a great resource for that, but I don't think that they're utilized that much, that often, or that regularly. Psychologists also said, I don't feel close enough to that person to say anything. And they're worried about, them being angry with them. I don't like confrontation, which there's a little irony there, aren't we trained to understand and tolerate different perspectives and to approach people in a way that is not threatening and not judgmental, but just saying, I have some concerns. Maybe it's nothing, but I didn't want to not say anything. I think, and again, I'm speaking systemically, that the failure of psychologists or the failure of our system to help us feel comfortable reaching out to each other and supporting each other in much more personal and professional ways, I think sends a terrible message to the people that we're training to be the next generation of professionals, that when we don't reach out to struggling colleagues or say anything about something that doesn't seem right, I think we send that message to them that we haven't learned to handle that yet, or we're afraid, and we will avoid that. And we're not going to like every colleague that we work with, whether in clinical settings, academic settings, other professional settings, but we can respect each other and hold each other with that kind of respect and dignity that we talk about a lot, and it needs to be among ourselves as well. So in another national survey, trainees, they found, were very capable of identifying perceived problems with competency even in their peers. They hang around with each other, they talk to each other, they listen to each other, and they have sort of an inclination to be pretty good at this. And yet, so they might have some concerns about what they see a peer doing, but their reluctance is there as well. And they really don't have a great model for handling that all the time. And so, you know, they keep quiet out of loyalty, and they don't want to jeopardize another student. No one wants to be the police state. So there is no training. And they also, in this survey, they expressed concerns about retaliation from their professors and supervisors, that they might be overly harsh or punitive. The colleague assistance programs that were developed with the best of intentions, and I know that there are some that work better than others. One of the problems with them may be that in some ways, even they explicitly or implicitly talk about competent versus not competent, and divide us into these two big worlds that you're either one or the other. And most often it's not that at all. It's that gray area we're talking about. Let's preventive and shoring up our colleagues and helping each other move to another developmental stage of competency. That's the area that doesn't get addressed very much. But I think, so what happens with the colleague assistant programs is that they, and I think, again, Diane was talking about how many, I think it was 16 no longer even have programs, and some of them, what was the numbers on that? Six that did have them were limited, and only 2 had formal and full programs going on. That's pretty sad. And why is that? Because these programs were designed to be helpful and address some of these issues. And but again, the words like intervention, confrontation, those are powerful message. That doesn't feel inviting. That doesn't feel like I'm going to get support. I'm going to get compassion. I'm going to get help necessarily. And so a lot of those programs have been discontinued because they weren't utilized enough. And in some of the worst scenarios I saw, they were in an effort to coordinate between state boards and maybe, let's see, state associations, state boards. They were demanding mandatory reporting at times. So again, turning something that was meant to be an aid to struggling professionals turns into another sense of I'm being watched and judged. Okay.
Elisa, I think we're going to take a break in just a few minutes, but I wanted to give you a chance to kind of.
This is probably a great, because now that I want to talk about the model that we want to move towards. So that will be going towards the end of, that'll take maybe about 15 minutes of presentation. And that'll get us to discussion period. What do you think?
Okay.
How long of a break?
Kyla, do you have anything to add?
Yes. Thank you, Tisha. I think this would be a good time for a break. Maybe about, I want to be mindful that you all can fit in everything of what you need to fit in up to about maybe 11:17 or so, about 7 minutes, 7, 8 minutes.
Okay.
Lisa? Okay.
That sounds great.
Okay. All right. Good deal. Thank you, Eric. Yeah, we definitely want to be sure our sponsors are recognized here. So of course we mentioned Arkansas Families First and Dr. Chelsea Wakefield. Eric, if you don't mind scrolling down to, I believe it's our silver sponsors. Just want to be able to thank you so much, Eric. Yeah, just to acknowledge our silver sponsors as well. So of course, Dr. Pat Griffin, she's a silver sponsor, but we know Dr. Griffin has been a supporter of ARPA for a long time, and just all of what we're doing with our professional development events and then other initiatives as well. So we thank Dr. Pat Griffin. and Clinical Psychology Services Incorporated for its sponsorship for this event. Yes, Dr. Griffin is the best. That's right.
Yes.
Dr. Griffin is the best. Absolutely. Absolutely. Appreciate all the wisdom and expertise and just support that she provides to ARPA. And then also UCA, Department of Psychology and Counseling. UCA, of course, I mean, we could probably go on and on about the role that UCA has played with ARPA over the years. But definitely in terms of student involvement, UCA's faculty members have been involved in our board and our leadership, our governance, and all just so many things that we have done over the years. So we thank them, UCA Department of Psychology and Counseling, for their silver sponsorship this year. Student and faculty at UCA are ARPA family. I love that. You're definitely part of the family. So we thank them for their sponsorship. Okay, I think that's all I had. Oh, let me say this for those of you that are on. This is a good time where we're taking attendance again. So when we do that at the breaks, so hopefully I might announce that again before we get back started with the panel. But if you are on and listening right now, if you don't mind just putting your name in the chat. Thank you. The names are coming in. Thank you so much. That just lets us know that you're still here with us and you're still a part of this panel. This is our way of just kind of keeping up. So when we send out the CEs, that we know who we need to send them to. All right, thank you for the names are coming in. Also, if you can keep your eye on the chat, Eric is putting in the link to the evaluation. So for those of you that were here yesterday, please, if you haven't already, please fill out the evaluations for yesterday. And I think Eric put that in the chat a little bit earlier today, the one that we did on 1:30. He put that link in the chat. So if you could please pay attention to that, because I'm sure at about 12 or 12:15, Eric is going to put in the link for the evaluation for this panel. So please just kind of make note of that and fill out those evaluations for us as well. So putting your name in the chat and filling out the evaluation and getting that submitted, that's our way of tracking who we're sending the certificate to. All right, thank you so much. And I'll just turn it over. If anybody else has any announcements for the break, I'll turn it over to you for that. And just so for those that listen, we have probably about 4 or 5 more minutes of the break. So please stretch, take a restroom break, and do what you need to do. Yes, there was an evaluation for yesterday morning session. So Eric, if you're on, if you could please just put in that in the chat box. So please just kind of pay attention to the chat box. And if Eric, if you don't mind, put in the link to the evaluation for the morning session and that afternoon session in the chat box. So please pay attention to the chat box for that. That should be coming in soon.
That's actually what I was going to add to as well. Yeah, Kyla, that as we were talking offline, or that I plan on putting it in an email as well, but and I'll probably send out the evaluation for this a little bit before 12, but absolutely plan on doing it in an email, and I'll do all the ones for yesterday as well. It's just they get scrolled off. So.
Okay. Oh yeah, that's right. That's right. Excellent. Thank you so much, Eric.
Okay, it looks like it is 11:17, and to give us enough time to let Dr. McNair finish up and have some time for discussion, why don't we go ahead and get started? Eric, do you want to stop sharing your?
Oh, I'm waiting for Eric to switch.
Here he goes. There we go. You're back, Lisa.
All right. Well, I see you. Let's see. I see your name. My screen is, and I'm almost, no, here we go. There we go. There you are. Okay, so one of the concepts that's been talked about in terms of moving towards, I think what you termed initially the Wellness 2.0, more of a focus on human qualities, vulnerability, an integrated sense of who we are in our work life and in our personal life, that their community is emphasized, and the issue of self-compassion again. So moving towards a model of dealing with competency and dealing with a professional life that also includes us and includes us as part of that process of it's a very dynamic, complex relationship, whether you're talking about a student or a patient or a colleague that you work with. How do you balance, how do you integrate all those things? So the term that came up was that's being used is called a communitarian perspective. And while I've heard other names that describe this, I thought that this kind of philosophy captured it pretty well. So what they mean by the communitarian perspective is that you have collegial engagement focusing on the promotion of highest functioning and an emphasis on preventing problems with reduced or impaired competence. And this kind of model is not one about fixing a problem or repairing or judging or rehabilitation, but again, enhancing and promoting and preventing and stepping in. That sure, there's intervention, but stepping in at stages that before things become destructive or harmful. And this is a kind of perspective or way of looking at our roles and what we need from each other in our community that will serve individuals and institutions and our community much, much better. Johnson and others who did worked on this model and actually came up with a different name. They called it constellation, the competence constellation. But he and his colleagues were really critical of this and of this individualistic interventionist view of competence. And they thought what we need to be doing is encouraging more interdependence, communitarian perspective on competence, and an obligation to help one another. So that was the come from. It's like, look, this isn't working, and there's some gaps there. And when we're harmed, again, the oxygen in the airplane, if we're not functioning really, really well, those people we serve are going to suffer as well. So this kind of philosophy places a premium on human dignity, accountability as well, and just says, we're all interdependent with each other, and that social connection and interdependence is just part of being a human being, and to deny that is foolish and can leads us into darkness and difficulty at the very worst. We know from research that aspects of our behavior and our personality can better be assessed with greater clarity by others, and that closeness in a relationship is highly associated with greater accuracy and judgment. So especially in terms of personality and emotional functioning. So when we have people that we trust, who know us really well and we feel close to, and they can give us feedback that isn't judgmental, but just an assessment of what they're seeing externally, then we have a better chance of functioning in a much more adaptive way and self-correcting at an earlier point in time. So I mentioned this competence constellation, which is sort of the title that they gave this idea of how do you enact or create these kinds of communities for professionals. And really what it is just what they're referring to is a cluster of relationships of people who have an active interest in fellow professionals' well-being and their professional competence. The well-being is not left out. It's not separate from who you are as a professional and just supporting people in career success, which is important. That's an important dimension as well. But it's also supporting people in how to work family balance or I'll want to talk a little bit more about how complementary skills, I can share this with you, but could you help me with this? You seem to know more about working with this age group or this population, and I've got this client that needs this. So there's a complementary and a kind of complementary type of interaction that happens. So I would say one of the things that was interesting about this is everything old is new again, is that when I worked as a graduate student on my dissertation, the hot new theory was this ethic of care that Carol Gilligan talked about. And this is very much rooted in that, in the work that she did around a community of care or an ethic of care. And that is, we are concerned not just with your professional achievements, but also your functioning both professionally and personally. So some of the features of this competence constellation, they talk about peer mentoring and relational mentoring. And I would describe those types of mentoring as very, very similar and sometimes hard to even distinguish the difference between them. Relational mentoring probably goes a little bit deeper, expanding the range of what you would be willing to talk about with your group of friends or colleagues that you've put together for yourself. So peer mentoring would be a lateral relationship that provides social and emotional and professional support. It goes beyond graduate school, although I think that those kinds of peer mentoring relationships often begin in graduate school. And you don't have to leave them behind, but you probably will build new and expanded ones as you leave that particular system. Relational mentoring is probably a little bit more refined and a little bit more intense, and they're often made up of dyads, like someone that you really trust. Maybe you work with in your clinic, that you meet regularly and talk, and maybe go a little bit deeper sometimes about what you're struggling with, a little more vulnerability around your professional identity, around what is happening with patients that you're seeing, but also what's happening with you personally too, and how that might impact your professional work. So some of the characteristics of these mentoring relationships is that they're lateral. Usually it's not a hierarchical relationship where someone has power over you necessarily, but they're reciprocal. So that's mutual, you have some shared interests, you're invested with each other. They tend to be fluid and complementary. Colleagues learn to switch back and forth in a very authentic way, saying, could you help me with this? Not always deferring, not where there's a power differential where you're always deferring to one of the persons in that group or that dyad. That there's communal norms around relational mentoring, but you're also able to look at developmental needs. Where are you? At what stage are you in your professional life or life? So the psychologist just out of graduate school who's trying to build a practice or get a new job is very different than someone who has very different needs, I would say. Very specific needs than someone who's been in private practice or working for an institution for 15 years and moving to private practice. in each of those scenarios, you're going to need some help from other people about how to make those transitions. How do you get set up? What do you need to know that you don't know? And so understanding where your shortcomings are, what your developmental needs are, and what you need from this community that you're setting up. Also, there's an extended range of outcomes. You're not just focused on careers, but professional identity, enhanced competence, work, family balance. It's holistic and requires effective communication, empathic listening, self-reflection, emotional intelligence, and capacity for compassion. So all the things we bring, hopefully, to the clients that we serve and provide services for, we bring to each other as well. So not being startled or judgmental when a colleague that you held in regard suddenly does something that seems rather foolish and out of character, but understanding that we're all capable of doing things at different times in our lives with particular vulnerabilities that we would not have seen coming or did not see coming. And these developmental networks. So these are different kinds of mentoring relationships. Again, have more subtle differences, but a lot of overlap in what they are hopefully going to be able to do for you. But these networks are these sets of relationships that you have people that are interested in you. And I would say ARCPA would be one of those developmental networks. Absolutely. It could also be your peer group in graduate school is a developmental network. But they can be networks that you form where you work with people that you trust, that maybe you've worked on a team with and you like how you work together, and that expands into something else. What's different with this model, one of the things that they hope to do is the intentionality, the awareness that we need these. We need these relationships. We need to find people that we trust to talk to about what we're uncertain about, feel silly or dumb, or I should already know this. Everybody else seems to have it figured out. That kind of mentality just does not serve us well. And I do think a lot of us have done that intuitively. I was listening again to Dr. Brickman. I was real appreciative of, she noted some just groups that she has set up with friends and colleagues outside of her professional association that she's real involved in, from my understanding, in that colleague to colleague. And then she talked about concerned psychologists that held something different for her and her colleagues and her friends, that she wanted to talk about some other issues that in one setting didn't seem to fit as well. So setting up another system. That's exactly the kinds of that's the kind of intentionality this competence constellation or communitarian kind of model says we need to be moving towards, that we need to be setting up these systems for ourselves. Now, I think intentionality is really important, but but I think it's missing something in their model, and I will come back to that as well. I want to mention one more thing about this constellation model or communitarian model, and that is the role of diversity and density. And that when they talk about diversity, it's just you need a range of people, not everyone who has exactly your same views, exactly your same life experiences, or even your same socioeconomic background. In fact, in their proposal, they said the range of diversity is so important. It should reflect a range of individuals with varying experiences or backgrounds, especially of privilege and oppression. And I thought that kind of a nuanced point to be made, not so nuanced, but a very important point to be made, that we tend to gravitate towards people who think like us. They go to the same things we go to, we share a lot of interests, and that is great, and there's nothing wrong with that. But to be intentional about seeking out people that maybe have a different perspective, maybe have slightly different political views or big differences, whatever your tolerance level, but the diversity is so important. And there's a book by Page, I've got a reference for that, that anyway talked about this issue of identity diversity, saying that it has possibly the greatest impact on problem solving, innovation, and performance when combined with cognitive diversity. So it's not just your own ability to think and shift gears and have a lot of different resources intellectually and privately, but being engaged with people who are very different than ourselves or have some differences and different experiences, that combination makes just a powerful duo in terms of really seeing problems differently and thus being able to come up with solutions that are different and more innovative. Density was that other feature that they talked about being so important. And that's the degree to which colleagues in your network kind of know each other and know you. It doesn't have to all be the same, but there needs to be some level of communication and connection. So how do you change the culture? I think it begins in training, really probably begins long before that, but we'll start with training issues. So applying this kind of communitarian model across clinical, research, teaching domains by promoting collaborations, mutual support. It's just cultivating that culture. It's normal to ask people for help. It's normal to share concerns you have. Practicum should be one of those settings where you go, gosh, I really messed up, and have a practicum supervisor being able to capably kind of talk about that. Let's talk about some as a group and maybe some that's private, and that you offer further, maybe more focused feedback that will help students that they can tolerate better privately. But some of it, learning to be able to process it as a group is going to be very, very important. Also, they must model that. They have to show that they're engaged with their own colleagues, that they know how to work together, play nicely together, and not critical of what other people are doing or competitive about what other people are doing. And that can be really difficult because, again, we're human. Some of the examples given is that a trainer or supervisor might talk about their own vulnerability or times without self-disclosure that's appropriate. And that is, let me tell you about a time in my early career when someone really helped me. This is an example of when I reached out to a colleague when I was really unsure about this, and that it was just so helpful. Just that responsibility for patients and care is complex, and that it's always been complex, and it's not because they're students, it remains complex. And I'll give a quick example. When I was just starting out, I joined a supervision group, and I was surprised that other people weren't doing a lot of that. And I think in some institutional settings that might have been provided, I'm not sure, but stayed with it for years. And I cannot tell you how incredibly helpful that group of colleagues was for me as a new therapist in private practice. But an issue came up one time where I was sharing with them about some work I was doing with the psychiatrist, collaborating on something. And there was a reaction, a pretty negative reaction, like, oh, I think you might be in trouble there. And I felt really anxious and terrified. I'm like, I'm just barely getting started here, and I'm in trouble already. But I will say it wasn't attacking. It was raising kind of an alarm, like, I don't know, this relationship that what y'all are doing together, I'm not sure that fits, respects kind of the parameters of our profession. And so I was, we talked about it a little bit. And what I did is I went to APA and did a consult with them around what I was doing, and was greatly relieved that it was okay. And then came back and shared it with that group. But I was thinking that was 30 years ago. And it was so wonderful that my colleagues felt strongly enough about my well-being. They were like, you may need to step back and check this out first, kind of thing. I'm not sure. I didn't feel judged, but I felt like concern, and was able to do that. And if it had been something that I was doing wrong, it would have been something I could have corrected so much earlier than down the road. So again, just, we need to figure out ways to create resources in our professional community that are going to assist people. And again, I want to talk again about that. This model, this communitarian model, I was so happy to see it. I think in spirit, it's right on, and making the point of how those networks need to look and how intentional we need to be about setting them up for ourselves. But I think what gets left out so far, what I've seen, and I think there's probably other models of of collegial assistant programs that I want to be looking at that may help be more helpful around how they do this. But I don't think there was a lot about how our professional community, and maybe in particularly ARCPA, can foster some of the efforts we're talking about. It's one thing to say, go, it's burdening the individual again, go out and form some networks, go find some people that will mentor you. Well, that's difficult to do when you're just getting started. Early career, transitioning from graduate school, newly relocated to a community, people who are returning to a clinical practice or an academic practice after some time away, people who are isolated in their practice for a number of reasons, or in their teaching situation or the research situation, members of marginalized communities, people just who feel isolated. Tell them to go set up these mentoring groups. Tell them, you need to be doing this for yourself. I think, again, the burden, we do have to do it. It is ultimately on us, but there could be more assistance there. There could be more leadership around that. Again, starting in graduate school, but what can we do as a professional community now? And I think this is where our association can really bump up our game about how we do that.
We've got about 20 minutes left.
How many?
About 20 minutes.
I'm
finished at noon, so.
I'm about, this is it, really.
Okay.
So the ideas we've talked about some in our ethics group is that wouldn't it be great if we could set up panels where members of ARCPA kind of could rotate in and off. No one's carrying it. No small group is carrying it all the time. Rely on some of the senior psychologists that have been doing work for a really long time, but definitely have a variety of people at different levels in practice that contribute to some of the questions and some of the answers for how to do things. I mean, technology, certainly I'm not going to be the expert with that. But being able to talk about ethics issues, being able to talk about how do you get things like, what do you do when you get a subpoena? The first time that happens, who do you call and ask about that? How do you find clerical help? And do you have to pay for it all by yourself, or can you pool resources with other people who might be willing to do that? How do you set up secure record keeping if you're working privately? Are there attorneys in the community that can be helpful? Do they understand these kinds of issues of our profession? And can someone point me in the right direction? So questions about practice that where you just don't feel so alone when you're getting started, or even if you're mid-career or late career. So I think that I know the liability issue comes up over and over again, but I do think there's a way to structure that. And I think making use of the psychologists in our community that are at different stages of their careers that can offer some time and maybe do this on sort of a rotating committee that people submit questions through emails or call-in questions, and can be anonymous and have a way of communicating that. So finally, finishing, I think what we're coming back to with all the changes that we've been seeing and our movement towards a more integrated way of handling self-care, being part of our community as both professionals and human beings, calls on us to shift and adapt to the changes. I remember many years ago, a mentor of mine, some of you might remember Dick Dana, who's really brilliant guy, but struggled with technology too. And I was in his office one day and I said, I just see this getting bigger and bigger. And, are we going to become obsolete? And he looked up and said, high tech, high touch, we're never going to be obsolete. But I do think we have to adapt. So I think that's it. Questions? Tisha?
Thank you, Lisa. That was so helpful. And I love that you pulled in kind of what we can do, because that was some of the questions I had. And I think you've really segued there. I wanted to share my screen for a second because I found kind of a visual of what you were talking about.
Okay, I'm trying to get you back.
The constellation. You guys see that?
No, I'm seeing every, let's see. Is this it?
We see your screen, but it's not anything specific, Tisha.
I'm not seeing your screen right
Let's see the
now.
constellation.
Uh-uh.
What screen am I sharing then? Just
Your
read.
home screen with all your files.
Yeah.
You can see all my fun. Those are all my screenshots from doing all the, this is my third presentation this week, so it's been a little crazy. I overbooked myself just a tiny bit. I will stop. And I will try again. I think this is it.
Yes.
Now, so this is just a visual of what Lisa was talking about, the competence constellation. So kind of looking at the psychologist at the core and then kind of building these relationships, these communities around each of us. So I really like that. And I put the link to that article in the chat box. It's a really interesting article. It'll also be in my resources. So that I thought that was really awesome. Thank you so much, Lisa. So basically I wanted to open it up for discussion. I had a specific question that I hope that Diane could share a little bit about, and also Lisa could add to, is looking at some specific tools for self-awareness that we can use to assess where we are and to also assess maybe our constellations. And Diane, I know you have a specific handout that you've created that helps us to do that self-assessment. So would you mind talking about that for a couple of seconds or a few minutes?
Sure, I can. And thank you so much, Lisa, for your talk. It was really helpful and interfaced nicely with Tisha and I have been talking about as well, brought a lot of things together. I did an APA conference with David Shen Miller on the communitarian and this approach you're referring to a few years back. And my own assessment is an informal one. It hasn't been rigorously tested, but it just asks you to look at where you might be in your stage of doing your self-care and your work and to make some notes. I give you, it's a couple sheet piece of paper, but write out another sheet of paper so you can keep a record of doing it maybe once a month for a while or once every few months, how you're handling situations and how gracious you've been to yourself. It builds in that piece of it too. Where do you get stuck? What could help you next time? What are you learning from the experience? And are you being mindful of how you address the issue? Not berating yourself, but being understanding of yourself. So it takes you through various stages and looking at it through a lifespan approach. So that it's pretty straightforward, and you're welcome to give it a try or adjust it to fit for you and see if it's helpful to give yourself some feedback. Thank you, Tisha.
No problem. And I put a link. So I took your handouts, Diane, and made them into Google documents so that we can link to them. So there's a link to that in the chat if you guys want to take a look at it. I think it's really helpful. And if you look at kind of like the literature, and Diane's been looking at the literature for a long time, there's not very much that helps us personally in our profession and the way, in the way that we practice to do some self-assessment and to really think about, where we are and where we want to go and do some goal setting. I could also see this could be really helpful in training at every stage, as Lisa was talking about, of our professional lives, is to start out in this evaluation phase and to really talk about these things and where am I and where do I want to go, and having that awareness of how do I know whenever I'm maybe in the orange zone, the danger zone, and do I have a plan for how do I get more into the green zone? Lisa, do you have anything to add about like self-assessment and kind of, assessing those our collegial groups?
Well, I mean, frankly, I think that, we're a skewed population where there is a lot of self-reflection. There is a lot more concern about how we feel, how we think, hopefully. I mean, I think that's safe to say about us as a population. I think it's around the self-assessment of how we're actually performing. And I think it can get distorted both ways. You could have an inflated sense of how well you're doing, and I think you could have a diminished sense of how you're doing. So I think it does go back to having people that you trust and respect, and being open to feedback that may be hard to hear. And I think if you look at the close relationships in your life, they tend to be close because they allow for honesty and discomfort, quite frankly. And it doesn't have to be, I'm putting myself out there to be judged and to totally criticized. A good assessment, we know, gives people both their strengths and weaknesses or areas of vulnerability. And I think that we do have those skills, but again, I think we deliver them better than we serve them on ourselves. So I think it's heightened if we've got these networks and these mentoring kind of relationships, collegial relationships, where we can ask someone, what do you see? Or this is how I'm handling this. Do you have any other ideas? Or what have you noticed? Or going to someone when you're concerned, saying, I've observed this.
One idea I have is you could take that little circle and maybe even write in, like, who are these people in my life, right? I know that for me personally, I've had the really good experience of my best friends are also psychologists. So you get that extra whammy of knowledge and help, and the real close relationship with knowing your professional needs. And so, I think that's just invaluable. And I'm sure not everyone has that. I was actually complaining earlier this week that that's also I can't get anyone to tell me what I want to hear because my best friends are psychologists. So like, they
do tell you good things too, right?
Yeah. They're too honest. Like, oh, I know you're going to be honest with me. That really makes me mad now. Another thing that I wanted to touch base on was, thinking about next steps. Like, Lisa and Diane, what do you think about as far as what we can do as a community? Real steps that we could take in the next few months and years, and to put this into practice.
Lisa, do you want to go first with that?
Yeah, okay. We actually had a little group of the ethics committee kind of met pre-pandemic and talked about some ideas and concerns and some of these obstacles, and got excited about it. It was probably the last ARCMA meeting. And frankly, the setbacks with pandemic and people getting just caught up in all kinds of different things going on, not a lot of movement towards that. But I think the next steps have been, and I actually have pulled some of these, the colleague assistance programs that are working, and taking a look at how they overcame those obstacles of concerns about liability. What is the process they have in place of reaching out to their community and providing that kind of resource to people. And then I think coming up with a model and just advising the ARCPA board a bit about some possibilities and whether or not they want to adapt or adopt something like that. And so I think there's that. I think it's just putting together some proposals that these are some models that work, and ways that we could be, and how do you want to implement it? How far do you want to go with this? And there's the mechanism of delivering it. And I don't think it's impossible. And I think that there are enough people that are interested in this issue, if it's not going to be something that's so burdensome, that is real workable for them, and then they can kind of just share expertise as needed. I think that's kind of what the kind of model we're looking for.
I would just come back to the 2 steps that I talked about that I've developed, and we have found it's working pretty well, and you could formulate it based on your people and your population area. And the 2 were the concerned psychologist group, we're not part of our association. We're all from the association, but we found we felt inhibited talking about some of the issues, political issues and social issues in our listserv for our professional association. So this model allowed us to be as free and open and to talk about how it affects our clients, how it affects us. What do you do when the client talks about what's going on with politics, and how do we address that and deal with it, and how does that make us feel? So that's been really a wonderful place. It was really easy to set it up and straightforward, and we don't worry about any liability issues. And then the other one was within the Psych Association, the colleague to colleague, where we promote, we're just holding and listening. It's confidential, it's not therapy. And yet here are the resources if you need to do something more than that. So those 2 really help us get around the issue of the liability, still providing a forum of sorts for us to be there for each other.
And I think it's sort of a hybrid of those 2 if we're going to do it as an association. And I certainly agree doing it independently. And I think that's what a lot of us have done over the years. We've developed our own mentoring groups and listservs, just group just that kind of broad communication. I don't think that's the safe space for people to really be able to explore some of the things that they feel most vulnerable about. And it really does need to be more of a dyad or a small group that's designated just to process those kinds of things, not to have a dispute about political beliefs or what's made them angry, not a dumping ground for I'm angry with the world or this is unfair, but just I've got a difficulty or I have a question. It's simple everywhere, from a simple question to more complex. Who can I go to push me in the right direction to know where I might find out more? So it's just safe, and it needs to be, I don't think it needs to be these big platforms of people having open. Yeah.
So we have about 7 more minutes. I wanted to open up to the audience. If anybody wants to unmute and ask a question or put something in the chat. I haven't seen anything in the chat so far, but please just unmute yourself and join the conversation.
So hi, it's Cindy Michael. I guess so the role I am in currently is I'm working out of country for an NGO. And even though, and I'm a little bit, I'm very isolated, but it's kind of like once I took that role, it became, I don't have any kind of networks there because I'm not licensed to practice in that country. So I'm just doing consultation type things under the government knows I'm there. So it's not a big problem, but it's a problem with how do I form, like, how would you think about going back to forming some sort of little consultation or kind of group here that I could tap into, because in the role I'm in, I still run into some ethical type dilemmas that I would really like to ask questions about. And I've had one recently. So it's kind of like, what do you suggest I do?
What are you talking about, just forming a network where you are, or what are the limits of forming a network? Because I think you can still reach out to people that you've already formed some networks with because of these kind of platforms, Zoom platforms or FaceTiming or whatever. So I think you might just want to think about who have I gone to and pose that very question and say, how can I get set up with something? But then I think it's for you to, and maybe part of the discussion is looking at who's in your immediate community there, where you might have more contact with them face to face, if that's needed, and that kind of support. Just maybe you start with old resources that you relied on, and then start to think about with intentionality about how am I going to build something here, expand on it here. You don't have to get rid of the old, but expand on where you are, and kind of sort through that, process that with people that you've got a history with of processing those kinds of concerns. I think it's okay to reach out, is the bottom line.
Yes, I would just add to and absolutely agree, Lisa. I think even sending an email out or to your listserv, both the one you're in the United States and the one you're in where you are working, to both of them, just saying if anyone would like to touch base and check in and talk with each other, you don't have to go into what the issues are at all, but just to have an offline check-in. Then you'll have the few who will come up, and you might say, if you've had experience in this area or you have some interest, let me know and we can set up a time to talk and get together. So you could formulate that list based on who responds to you and how it feels to you. But I think it's a great idea that you sound like you're kind of isolated, and absolutely understand that. And so it is important you get the support as well as to problem solve with someone. So it's wise of you that you're reaching out. That's a really good point.
Yeah, and she added, I guess I needed permission for some weird reason. And I think, that's the point of all of this, is that I think we do think sometimes we need permission, and we don't spend as much time as we should, and I'm pointing at myself as much as anyone else, in thinking about like how important this is to our health and well-being and our professional health and well-being, and that this is so important, and that we can, and it's actually encouraged, and I think in some ways it's not mandated, as Lisa had talked about it, but you certainly get the weird eyebrows whenever something's wrong and you haven't done it, right? Like you should have, like, even though it's not something that you're required to do, it's something that you're required to do after something bad happens.
Right.
And so if we can think about it more as a preemptive and growth opportunities, it's about.
I remember the
about
use of
preventing bad
scaffolding.
things.
Think about scaffolding and developmental research, that idea of you're at this place, but you're trying to deal with other issues. And we provide the scaffolding sometimes for each other.
So in the last minute, I just want to express my undying gratitude to both Diane and Lisa for the time that they've thought about these things and spent the time to formulate their ideas and share with us. And I want to express my gratitude to Kyla and Betty, and to Pat and Jan and all the all the professional development committee for putting this on, and for allowing me to run with this. And also thank you to my wonderful ARPA family. I cannot wait until we can get together again in person.
Yes.
And I've got my slides, and I've kind of put together resources based on what Diane and Lisa have put together, and I will get that to Eric, and he can get that out to everybody. So thank you.
Oh, great. Thank you. Thanks for all your help. And it's good to hear from everybody.
Thank you very much. What an incredible audience. But I must say, what an organization you have that there in Arkansas. It's uplifting and heartwarming and wise that you bring people together to talk about these important issues in this way. You're probably way ahead of a lot of state associations. So take pride in yourselves for that. And Tisha, for bringing this all together. It's been meaningful and helpful, and I applaud everyone, and thank you so much.
Thank you. Thank you, Tisha, and the rest of you, everybody in ARPA, for getting this all organized. It's a lot of work. It was nice to meet you too. See a face, connect a face with an email. So, Diane.
Right, indeed.
So yeah, absolutely. Like you're saying, Lisa, it is work, but it's well worth it to be able to have these times to come together like this. So everybody is saying in the chat, thank you so much. Thank you so much. Great job. Great information. I agree with that. So please, everybody, keep in mind that this is being recorded. It's going to be